Hey, good morning. Good morning, Guam. 6:16 as the rain falls outside our Harmon studio window to cleanse this island. And it's Tuesday. What, Brio's getting a little descriptive out there. You know what I mean? It's gray and cloudy. Guam's favorite, it is the KUAM News takeover of I-94 KUAM FM. I got you 617. Good morning, Sabrina.
Good morning.
Hold on. What mic are you on?
Oh, it's the wrong mic.
Yeah, it's okay.
Yeah.
We'll switch it later. Okay, you want to switch it now?
Yeah.
Right on.
Can we switch that?
Hey, so, of course, we're doing this containing COVID thing you might have heard about, and we're bringing it out to you guys as many ways as we can. Right here on the radio where it all began, it is Guam's favorite, 93.9 FM. And we're also streaming KUAM.com, and on the KUAM News app, there's an audio stream in Docomo Channel 10. And then remember, 8 o'clock to 10 o'clock, we throw the show on to KUAM TV 11. And really grateful for that because yesterday we got a call from a guy who's locked up in Pacific Star quarantine, being held against his will. Literally, I mean, he wants to leave.
Yeah.
And
by the time he got off the phone, he was having a loss of taste and a loss of smell.
It's crazy how that happens.
I know.
There was a little bit of coughing. So, yeah, and the only reason he called into the show is because he saw it on TV. Mm-hmm. They're at the Pac Star. So we are your official morning radio show of Hotel Quarantine. The number one choice of Becky Respicio and Alice Tyron. Good morning. Just so you know.
Yeah, hey. Please give us a call, 637-0094, whether you are at Quarantine Hotel or at home. We'd like to hear how you're doing.
Yes, we want to check in with you guys here, 618, and there's a lot of good news coming down. Some of the guests we got coming on the show for you guys. We'll have a Superintendent of Education, Mr. John Fernandez, and also from the Department of Public Health and Social Services, Dr. McGlutney are going to come on and kind of break down some of the science behind these recovered cases that have since retested positive for COVID-19. Also, he's supposed to be the new sheriff in Adelup. The acting chief of staff, John Jr. Calvo, will be coming on with the policy director, Carlo Branch, Mr. Sorry. We'll have more of that coming up later. And as always, the show is brought to you by IT&E, Calvo Enterprises, and Ambrose Inc., and let's do it. We always start the show with a dive into the day's COVID-19 headlines from the KUAM News team with the very latest. Good morning, Sabrina Salas Mantanani.
Hafaday and good morning, everyone. According to the latest from the joint information released at 9:40 last night, Public Health tested 42 individuals for COVID-19 on Monday. 0 tested positive. The results include samples from clinics, hospitals, and the quarantine facility. Public Health has targeted areas where infection may occur due to lack of access to health care and in densely populated apartment complexes. To date, there have been 149 confirmed cases of COVID-19 on Guam, 5 deaths, and 125 released from isolation. Again, when a patient is released from isolation, he or she is no longer considered infectious. According to the U.S. Centers for Disease Control and Prevention, research and published guidelines, a patient is released from isolation after at least 72 hours have passed with a fever or additional respiratory issues and at least 7 days have passed since symptoms first appeared. All remaining cases are in isolation. Some cases that were previously released from isolation have returned to active isolation status after retesting positive for COVID-19 through follow-up testing. Again, the number we received yesterday was 6. The remaining amount of stimulus checks will be on the way following the IRS and the U.S. Treasury's approval of the Department of Revenue and Taxation's implementation plan. DRT had been waiting weeks for the feds to give the green light and the funding to cut the estimated $140 million worth of checks. The governor had fronted the first $11 million in local funds to pay out checks to those on Guam making under $10,000 in 2018. No word yet on when the remaining balance will be paid. DRT Director Daphne Shimizu says the feds are working on providing the funding for EIP, and she is looking forward to paying out the monies as soon as possible. Again, the U.S. Treasury and the IRS giving approval to DRT for their implementation plan and the stimulus checks to be paid out. Governor Lulian Guerrero and Lieutenant Governor Josh Tenorio, in the meantime, will visit Reventax this week to thank employees who have been activated to work on the processing of EIP payments. The governor is expected to announce two major initiatives today. Her regular press briefing was canceled on Monday, according to Adelup Communications Director Janela Carrera, so they could complete work on the two initiatives. One will be on transparency and spending. The other will be about providing direct assistance to those affected by the crisis. Carrera would offer no further details. Meanwhile, Senator Jim Moylan is one of a growing chorus of senators calling on the governor to release CARES Act money GovGuam already has to be used for displaced workers who are struggling to put food on their tables. Senator Moylan saying the CARES Act funding that's been received is separate from any pending unemployment and stimulus assistance. The Republican senator says he introduced a bill to release payments immediately, although it's not part of today's emergency session agenda. And speaking of session, senators are set to meet in emergency session this morning for the possible override of Senator Therese Terlahi's bill mandating greater transparency over coronavirus crisis spending. Senator Terlahi said it's important in keeping the public's trust. The governor vetoed the bill, saying federal mandates already require her to disclose how the funding is spent. But Terlahi is seeking more openness for her and her colleagues on behalf of the public, and she's optimistic there are more than enough votes for an override. No word yet on whether any other measures will be taken up. Last week, senators approved a change to their standing rules that allows them to conduct legislative business virtually or online. Session is scheduled for 10 o'clock in the morning. Responding to concerns from Guam's displaced workers, Vice Speaker Talina Nelson sent Freedom of Information Act requests to the Guam Department of Labor and Department of Administration regarding the Pandemic Unemployment Assistance Program. The Vice Speaker additionally sent pandemic-related information requests to the Department of Corrections, the Guam International Airport Authority, and Public Health. As thousands of displaced workers on Guam await federal aid, the Vice Speaker is seeking more information on Guam DOL and DOA's progress in setting up local guidelines for Guam residents to avail of the PUA program. From each agency, the Vice Speaker, on behalf of the people of Guam, requested information regarding the following: unemployment guidelines pertaining to Guam, PUA guidelines and the process by which public may apply, status or progress on implementation of unemployment insurance and the PUA, suggestions and recommendations for the 35th Guam Legislature's role in assisting with implementation and execution of all of, the above. Adelup Policy Director Carlo Branch says he is responsible for the muting of the media at last Thursday's governor's press conference. Lieutenant Governor Josh Tenorio telling KUAM's multimedia show Containing COVID that he expected Branch and Adelup Communications Director Janela Carrera to apologize to the people of Guam and the media. An apology by Carrera was not issued. In national news, 1 week ago, President Trump said there could be 60 to 70,000 deaths from the coronavirus in the U.S., but with the death toll at more than 65,000, the president is projecting even more deaths. Skylar Henry has more details from Capitol Hill.
Shut it down. Look, we're going to lose anywhere from 75, 80 to 100,000 people. That's a horrible thing.
President Trump says the death toll projections may be on the rise, but he also predicted a COVID-19 vaccine by the end of the year.
Maybe it's going to be a vaccine, or maybe it's going to be that this virus will pass. It will go. Will it come back? It might. It could. Some people say yes, but it will pass.
That optimism helps explain why the president wants states to open as quickly as possible.
Certain states are going to have to take a little more time in getting open, and they're doing that. Some states, I think, frankly, aren't going fast enough. I mean, you have some states that, Virginia, they want to close down till the middle of June.
Congress is partially reopening today. The Senate is reconvening this afternoon, where debate over the next round of coronavirus financial relief is already becoming a partisan fight.
Trying to get people back to work and not clouded with multiple other outside issues, either from the Democrats in the House or from the White House or from the Republicans in the Senate. Let's let's just focus on helping the people and coming together in a bipartisan way.
Democrats say state and local governments will need billions of dollars to keep first responders employed. Some Republicans are calling that a blue state bailout.
They want bailouts for the states, the Democrats, and really it's a number of states that frankly have not been managed well by Democrats over a long period of time. So we have to be very careful about that. Very careful.
President Trump also says any relief package must include a payroll tax cut, something Democrats in Congress oppose. Skyler Henry, CBS News, Capitol Hill.
Skyler Henry, CBS News, Capitol Hill.
And finally, in your banking 671 report from Bank of Guam and Coast 360, another reminder that as stimulus checks are put in the mail, that you are able to cash your checks at any of the following banks, even if you're not a member: Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. The Guam Bankers Association also reminds the public that to avoid waiting in lines, you can use ATMs. And for those of you who have no banking relationships, you may be asked to line up in a designated non-customer check cashing line and will need to provide 2 valid IDs. That's your Banking 671 tip from Bank of Guam and Coast 360.
All right, thank you very much. Sabrina Salas-Matanani, 626. Sorry, we had that Carlo Branch apology, and we'll just go ahead and play it now. I'm going to pop it up. It's up on our KUM News SoundCloud. I think there was also a clip of it going around on WhatsApp last night. But it is, again, the apology that Lieutenant Governor Josh Tenorio had said media and the people of Guam should get.
Yeah, I actually wanted to say to you, Chris, that I think 3 groups of people are owed an apology. First and foremost is the reporters who participated in that press conference. The fact that I gave an instruction which resulted in them being cut off or them feeling like their right under the First Amendment was not respected is completely my fault. I should give better instruction, and I'm responsible for that. You know, the people of Guam deserve an apology because we can constantly point to examples in our history of people who work for the government and think that they shouldn't be subject to scrutiny. And I never wanted to be one of those people, and that's wrong. And third, I extended my personal apology to the Lieutenant Governor and to the Governor. And the Lieutenant Governor had the strength and moral fortitude to apologize to the people of Guam on the radio this morning the moment he was asked the question. The fact that I had to wait for reporters to ask me the question shows that I'm not as brave and forthright as he is. So those who serve the Governor and Lieutenant Governor have to serve them well. And that day was not one of my better days.
Yep, that's it.
Hey, everybody. Jason Salas from KUM.
Jason. Yeah, hey, check out our KUM SoundCloud, by the way, with Jason Salas. So, yeah, Lieutenant Governor Josh Tenorio on the show, kind of creating, I felt it was a shockwave, and really kind of showing that it's almost like the left hand doesn't know what the right hand is doing down in Adelup. We had the Lieutenant Governor on yesterday, Sabrina, in a much viewed and listened to interview, and he had told us that there was going to be a press conference yesterday.
Right, and as you can see, that didn't happen because they are working on their 2 major initiatives on transparency on spending,
and giving away money. Give us American money.
Yeah.
And so, hey, it's smart, you know, from a spin standpoint, a policy standpoint. They managed to avoid, other than Lieutenant Governor Josh Tenorio coming out on our show, all interaction about this whole muting of the media. Mm-hmm. By not having a press conference yesterday, by not having one Friday, by not having one Sunday, by not having one Saturday, the governor was able to avoid the line of fire on this whole issue of not just muting the media, but the procurement that was arranged by her chief procurement officer / legal counsel. And hey, it's fortunate. So if you think of it politically, they successfully did that throughout the Lieutenant Governor. He took, you know, some damage. They put Carlo out, which is interesting because I remember when this happened, I spoke with Carlo Branch. I said, hey, was this your call? And he was like, no. Yeah. But I guess it was his call. And what'd you make of that apology, Bree?
I didn't need the apology. I mean, you know, it was the people of Guam that deserved an apology for that stupidity.
Right. And so Lieutenant Governor Josh had said that he wanted Carlo Branch and the communications director, Janela Carrera, to apologize. So obviously we just heard Carlo's apology. Didn't get one from Janela. Maybe it's coming. I don't know. Maybe she's writing something up nice. A lot of adjectives. But I think the most glaring apology absence was from the governor. I mean, let's be honest. The governor is a grown adult. She's the governor of Guam. She actually outranks Carlo Branch. It's crazy how that works.
Yeah.
But, if Carlo Branch...
what do you think, people that are watching or people who are listening, do you think the governor should be apologizing?
Yeah, let us know in the comments.
637-0094.
Yeah. No apology from the governor. And again, I just want to say that, Carlo Branch said that was his call and it was his decision and he's responsible. But he's not. You know what I mean? The governor of Guam is responsible. And I just feel like if we're going to make Carlo Branch apologize and the lieutenant governor is going to come out in front of this and apologize, it just really makes a lack of an apology from the governor of Guam that much more glaring, I think. And, in my opinion, while we're at apologizing, why not, start at the top? Because even though Carlo Branch said, hey, don't answer those questions, whatever, mute the reporters, the governor, in all of her authority, could have simply said, no, I'm going to answer these questions. People want to know. It's so simple.
Yeah. And, just thinking back, the first question was about, what was it, stimulus checks?
Right. Yeah.
And I don't think that was a difficult question.
No, she could have said, hey, they're finalizing it. We expect that it's going to be announced next week. How easy was that? Right. That was so easy.
And actually the good news came early this morning that the U.S. Treasury and the Internal Revenue Service finally approved the Department of Revenue and Taxation's implementation plan. Been waiting for that approval for weeks now. That approval came, and checks will be coming out just as soon as the funding is given to and transferred to DRT. Hopefully we can get Daphne Shimizu.
She's going to call in.
Oh, okay.
We got some comments here. A Branch apology is an excuse. Lieutenant Governor apologizes because he's sincere. Actions speak louder than her apologies. Yes. We got about 5 yeses on there. Absolutely apologize. Someone says she won't apologize. She's too good. So, I think it's kind of a no-brainer. There's a funny one here. Pretty soon the wheels are going to fall off with everything being thrown under the bus.
Mm-hmm. Or Chris, stop criticizing governor, lieutenant governor. They're doing the job.
Yeah, they are. And I'm not, criticizing. Am I? I'm just being critical, which comes with the territory. 637-0094, that's our number. We're going to take a little break, and we'll check in with our man in Sin City, St. Año Mayor Robert Hoffman, who's also the vice president of the Mayor's Council of Guam. And catch up with what the mayors are doing. Also, we're going to talk with Tomas Maglonia and the NMI. There's been some big developments in the Northern Marianas. Kind of a back and forth with Governor Ralph Torres and their delegate, Khalili.
Oh, yeah. Khalili Sablan posted on his Facebook about 4 hours ago criticizing Governor Torres. You want me to read it?
Sure. I don't know. You want to? Or... Go for it, for NMI listeners. Hey, what's up, Tato Marianas?
Yeah, Governor Torres claimed recently that the $36 million the Commonwealth received was from suggestions that came from meetings of the National Governors Association, or NGA. As you could read from the discussion below, Democrats in the House and Senate have always wanted to both increase funds to assist state and local, and at the combined written and requests of the insular area members to territorial governments. Republican majorities in the Senate, the White House, and Republicans in the House have opposed this effort at every step in the negotiations toward the now 4 legislation to combat COVID-19. President Trump has stated his support in principle to include assistance to state, territorial, local, and tribal governments in CARES 2 legislation that is now being negotiated. There is yet no agreement on how much funding will go to this program item in CARES 2. House Democrats have put forth a suggestion to fund the assistance by as much as $1 trillion. Just restating the facts and setting the record straight.
It's kind of funny how Khalili and Torres have their little thing, and then, our governor and our delegate definitely have some differences of opinion. Hey, more comments. Tony writes in, during these trying times, the governor should answer questions in the most honest way, regardless of how hard it is to answer. Instead of giving facial expressions, the people of Guam are left to wonder. Francis writes in, the people voted for her, so she should apologize. Michael McCleary writes in here, extreme ownership. A leader must own everything in his or her world. Leaders must first admit their failures, find a mirror in themselves, and never blame others. Okay. I mean, like I said, it's kind of a no-brainer, you know, who's going to say, no, she shouldn't apologize. She doesn't owe you jack. No one's really going to say that. 6:36. Okay, I think our man in Sin City, Zori on the ground, Mayor Robert Hoffman on the line. Good morning, Mayor.
Half a day, good morning.
Half a day, Mayor.
I guess just catching up. First of all, I know you heard Lieutenant Governor on the show yesterday. What did you make of that interview that we had with Lieutenant Governor Josh Tenorio?
It's always nice to hear his voice. I think one of the things, I think he's one of the most experienced people down in most of government. He's worked for all three branches of government, which is very rare to find somebody. So to understand the inner workings of how processes and requests are made. And so it was refreshing to hear him. And I think that's, I like the answers. He tells us what he tells us what he knows, and what he doesn't know something, he tries to get the answer and get back to you. So it was nice to hear him.
Right. What did you make of, a lot of people don't know that Lieutenant Governor used to work for FEMA or something, Bree?
He was the GAR, as I understand.
The governor's authorized representative.
Right, yeah. So he knows a little something about the procurement and all that with the emergencies, and so I thought it was...
Was he deputy chief of staff under former Governor Carl Gutierrez?
Right, yeah.
Yes, he was.
So he's been through those disasters right along with the former governor.
Right.
Yeah, so I'm sure he's familiar with the federal forms, the requests, and he's also in charge of the Guam State Clearinghouse. Yeah. So, he knows what it is to make requests and get the supporting documents and
the
all
reimbursements,
the reimbursements and all. So it's in good hands with him doing that, and it's nice that he's kind of I would say breaking out of his shell, but also, making sure that what he knows, and he's not embattled with any of these stuff.
Right. And having said that, though, it's interesting that he's not involved as opposed to,
He's involved, but I'm not sure what role he is playing. That's something I asked him personally as a friend. I said, "Where are you at in all this thing?" He goes, "I'm doing what he's doing what he was asked to do." And so I said, "Can we see more of you? Put you out more of you there and get an answer with you." And so he said he's a good soldier, and he listens and knows what he's told.
He was at that press conference yesterday, and all he did was sat there and then signed what did I say, Saturday? Well, whenever it was, and all he did was sign the executive order, and that was kind of it. Yeah. And watch the
parade, the S show. I know that's what you want to say, Bree. No, but I thought it was crazy that we have a lieutenant governor who's part of this administration who said the way this procurement was done by the acting chief procurement officer and legal counsel down in Adelup, it was red flags.
Yeah, I mean that's the thing is that retrospect, people are going to see whether what advice did other people have to proceed. So I know in this day and age everyone's trying to get you get one side of a good lawyer and tell you one thing. The other side of a good lawyer tell you another thing. You can get a legal opinion on both sides now.
Right, yeah.
Different parts. So they probably proceeded with some information that they had that they felt this was reasonable to move forward with. And so maybe it's not the norm that we're used to. Maybe they sought other information everywhere else. So, they got advice from other states or territories, or they're, like I said, lawyers will tell you basically different things.
I like how you put that.
But at the same time, you have people with experience, a lot of experience, like former Governor Carl Gutierrez, and I don't think that he was even involved with the economic recovery plan until we said, what about him?
Yeah.
Where is he in all of this? Why aren't you using people that have the experience, that have managed the island through crises?
Yeah.
And yet,
and the thing I think with Governor Gutierrez, I mean, I worked for him a long time ago on that, and it wasn't just one disaster. I mean,
multiple.
Plane crashed. I think he did the Asian
economic
crisis.
SARS,
the economic crisis. He did it was like back to back. It was like the year of unfortunate events or the ages of unfortunate events. It's like this guy, he's tested, and that's the thing. It showed it showed that while we were in the middle of recovering from PACA, we got Bong Song-Hwa a few months later. So it was he's more than capable of handling that. So to his credit, that's one of the things that everyone else saw on him on that is it takes great logistics and organizing and planning. So
And it takes more than one person, so it kind of looks like, and just putting together the story that Bree did yesterday, and some of the correspondence between the governor's legal counsel, Hai Hyun, it appears like he had just so much authority to just do whatever he wanted unilaterally to secure these quarantine facilities. And I'm wondering, like, what else was he out there procuring? And I thought it was very telling when there was something you put in your story, Bree, about he had said, "I've already procured this stuff, and all the other documents will catch up later." Mm-hmm. Which is, I mean, that's how did you put it? It's not the normal way we're used to seeing it done.
Yeah.
So and, I was talking to some people last night, and they seem to think that this whole thing should have been run through Civil Defense and Homeland Security as part of a disaster pandemic, or what have you, with emergency procurement.
Well, even on the mayor's council perspective, we kind of had some of the same concerns about it, because it's hard when you have multiple agencies calling the shots. So even just getting the information for like the villages at the time, it was not Homeland and Civil Defense. It was, they had to request it of Public Health, and they just Crystal and the team and Josh and all the other group would just prepare the press releases and send them out. So it's like, so you're not I said, it's nice to have the joint information, but if you're not the ones originating the information, not originating from you, these agencies can just send out their own press release and,
right,
do it on their own, and we can direct our questions there. So I feel bad for them, because they're put in that spotlight in the interview, like, explain this further, and they're like, oh, I got to refer you to the agency that actually wrote it. And so I'm like, okay. So kind of it became a frustration on our part, because as we sent in just tidbits of questions off the chain on those chats that we had, it would be like, let's send it to this agency and let's send it here. So it is right. It's a different type of disaster. And what we've asked for is, if there's this pandemic plan written down in a binder somewhere, can we see that? Where are we at this? Where are we at this plan? Show the people who I'm saying, okay, we're on page 66 now of this, because this plan says pandemic happens, these agencies get activated, this gets sorted out. This is what happens. You have one module of one team of people who are the medical experts. You have the team who's doing logistics on the ground.
Right,
so
yeah.
To me, I think people want to see that plan.
Yeah.
And I think,
and they want to talk to those people instead of just having the governor and Linda up there all the time. They should share the wealth. Get the LT up there, get some of these different agencies that are involved in the response.
The pandemic plan, I think it was Sean Gimatauta, he helped write it,
yeah.
which means that the former Lieutenant Governor, Dr. Mike Cruz, helped write it.
Yeah.
Carlo Branch helped write it.
Yeah.
Write it. Yeah. So that's the
they
thing.
would know.
It's the we know the drill for typhoons. We know the drill for even like earthquakes happening. About once an earthquake happens, we do the preliminary damage assessments. We kind of go out and do these things. Engineers are sent out. So there's kind of a roadmap of how to go. And I wouldn't say it's uncharted territory, because we keep saying it's part of this plan, the response plan. So
it's not, though, because Mayor, I mean, we're uncharted territory in terms of a virus and that type of emergency, right? But from what I'm being told, the same framework needs to be used for procurement that you would use in the typhoon. So there's whole processes through FEMA and through the mass care stuff, and so. What I heard was that they didn't even know that they had to conform all of the requests to these strict guidelines that FEMA has. And if you look at the email chain, it's like, hey, we're going to do this. Hey, we're going to pay these guys. Hey, I got the stuff already. Hey, the AG is going to sign it. Don't worry. Tony's about to sign this. It just doesn't hold up. There's a whole procedure, and it's crazy to me, because you have people at Civil Defense like Charles Estevez and, Chuck Atta, is running on the FEMA side. I mean, these guys know.
Yeah,
Carlo Branch, they know what you do, and it just it's like now we're trying to go back and say, no, this is totally normal. We're going to backdate it. I mean, how are we going to recreate this record to be reimbursed? It's kind of sketchy, Are they going back and backdating stuff now, or what's going on?
And I think that's the whole. I would say it's the difficult part is when it's an emergency, it's the scale of emergency, it's who declares who gets involved. Because I think I remember that FEMA didn't really get involved until President Trump was like pressured to be like, hey, you should get FEMA involved in this, because there's some kind of things that need to happen. So that's where I think it became this forks in the road, where it said, okay, who's in charge? Is it HHS? Is it You know, is it going to be Homeland? Is it going to be the National Institute of Health? Is the CDC in charge? So I remember the first few weeks of that whole Trump press conferences in the White House, people were like, who's really in charge here? Is it, you know, and remember the vice president, I'm in charge, and the HHS guy said, I'm in charge. I'm like, okay, everybody's in charge.
Right.
Mm-hmm.
So, and I think that's kind of where you're going to have that confusion. So maybe, like I said, maybe there's a process that we're not familiar with in terms of it, because if FEMA didn't get involved with it until, I think maybe 2 or 3 weeks later, I think is when I recall seeing that the U.S. FEMA decided. So the governor did her local closure here and with the executive order, and then the request was made for declaration, and Trump touted that he signed I think 14 or 15 at one time, and Guam was one of them, and then there's a thing. So I think it's whatever's in that presidential declaration, then it kind of probably says who's supposed to be doing what and where, and
right.
I think that's why it now says, Linda does this part here, but everything else should fall under this department, and everything else should fall under this. So it's a crazy nightmare of trying to get everybody to, it's like
I'm just like, okay, so Linda is the chief public health officer or whatever, so she's leading the public health part. But, she was very firm that I have nothing to do with the procurement. I got nothing to do with these quarantine hotels. I got nothing to do with my signature being on these. This is just, and I can understand why the administration went down in the bunker, with the exception of the LT, because they're not going to pop their head up until today when they're going to give out money. And so they're hoping hey, we're just going to ignore everything, come out and just, make it rain. They're going to unveil some big assistance program and hope that, people kind of forget about this.
Yeah, and I think and people won't. I think people want clear answers. You see that with the different senators requesting transparency, sending letters, FOIA letters, and all the other stuff like that. And I really feel it shouldn't even have to come to that. I think
it shouldn't.
It
should not.
It should not be the norm,
Yeah, and I think people are also getting they're getting tired of all the JIC releases. We're at 101 something already, and we post in our community stuff. They're not reading it anymore. They're just bypassing it.
Right,
I'm like, man, I think this is getting overkill, or they're getting just, that people are just be like, oh wow, okay, sure, Corona. I saw something yesterday. It goes, the federal government told us that UFOs exist, and it just breezed by everybody. Wow, what a 2020. In a normal news, it would be like, wow, there's UFOs, and we have murder hornet bees. But, it's like, yeah, sure.
Yeah, that popped up in our news chat yesterday. How do these murder hornets?
Oh my gosh.
So
how do you, Mayor? How do you think they kind of extricate themselves from this mess? Because I was thinking, how you do it is you put out the acting chief procurement officer, legal counsel, and you let him answer the questions. He calls the talk shows, he does the interviews, because he is the legal counsel. And I just looking back to Eddie, I know that if there was something of this caliber where it was like, Arthur Clarke or whoever, that they would be out on the front foot. They would be out, ahead of it, and they would be saying, no, this is why we did what we did. But we're not getting that,
This is my paper trail. This is how I did it. This is the advice that I got. This is where I sought the advice. Exactly. And I think that's the only way it should have happened on that end. The minute a question was raised about a process, it would have been like, okay, everybody stop, and we're going to address this. And, we can address this on the corner here, and we're going to kind of get you the information, what you need, until everybody's satisfied to say, here, this is all that I know. There's 20 pieces of paper. Here's all 20 pieces of paper. Nothing else exists, and this is it, and this is the guidance we got. Yeah. Like Bree said, if you came out the gate just saying, here you go, we're done, it would have been finished.
Yeah.
And so, I think that getting other people involved, and identifying who the leadership team is, who's giving the advice, and then kind of putting it out. I feel bad because it's to take a beating. The comments out there on everybody, just even as innocent as anything would be, it could be somebody out there, either an internet troll or somebody just be like, I don't like it this way, and give me this.
Mayor, just let me run through one of these, just 3 of these comments. I agree on the Lieutenant Governor apology takeover, a saving face for the governor. Politicians are corrupt. GovGuam wants to get paid too. They're forgetting about the people of Guam. Corruption. That's just, it's not even anecdotal at this point. If you just go through the comments, and the media is not really feeding it. We're just putting out what's happening. And I think it's just so egregious that, people are just, okay, so where's this chief legal counsel guy?
Mm-hmm.
Yeah, and it's not unique to Guam. I think several states and territories are having the same problems. And I think even the president tweeted that about, I don't think I should help Democratic states because they're badly run. So I mean, it comes from the president itself. So putting that out. So I think that's the things that states, territories, even countries are having the issues. I think I remember reading some articles about in Japan, they're having difficult time having people follow rules, and then also people asking about money and assistance. I think that's the same in the Philippines as well. So, I think the whole world is at this. It's for us. It affects us personally, and I saw those people who were making those comments. It's heartfelt for them because they're suffering. I think they said 38,000 people are directly affected or unemployed now on Guam, which is the largest, and so it's people are asking for this assistance, and people for asking. And so, one, it's hard being a world away. Two, it's we're a small island voice that's hard to do. So, I think it's time to kind of ramp up the talk with our Washington rep, or whether it be Madeline, whether it be Congressman Sir Nicholas, and everybody that just have this get in the face of the federal government saying, can you look at the paperwork? I know there's 53 other people you got to review and her plans and all these other things, because it's hard. Guam never had a unemployment program, so to ramp up.
Well, I bet we're going to have one now.
Yeah.
So how that got by people.
And hopefully, that's not just for this, but I think it'd be nice to just have that kind of unemployment insurance here, because it's so sensitive. Our economy, even if Guam reopens, tourists are not going to fly back, anytime soon. I don't think travel. I saw, Warren Buffett saying flying is going to be a thing of the past, and for decades the airlines tried to jam as many people into a plane, and now because of health they can't do that. So
now we're going to get some leg room.
Yeah. So, and I saw some of the proposed designs. They're going to make every other chair is going to face the opposite way, and they're going to have these face shields. And I was like, what?
Well, you're deep Googling, huh? You stay up at night. You just like.
Well, I'm trying to figure out.
I got the same problem.
Yeah, I can't sleep yet. So when you get to my age, you have to go to the bathroom twice before you go to sleep. Otherwise, you ruin your sleep.
I feel singled out. And, so Mayor, do you think that we're going to see the governor's legal counsel, Hai Hyun, at the press conference today, front center in front of the media to answer questions about this procurement? Ongoing procurement, like the AG.
It can be done in a separate. It can be done in a separate thing. If the governor really wants to just focus on what the medical doctors are talking about, or the public health side of it, then fine, do that and have a medical discussion only. So, and then on a separate case, have one where people can ask that questions and do that, so then they can get focused. Kind of stay in their lane and not either. You're not having people, and I don't know if the doctors are being compensated, and bless them for working and putting a team together, because one, to be a doctor this day and age and to kind of keep having to do this, my friends are doctors, and Dr. Argan is actually a good friend of mine, and she's constantly in meetings. I'm like, my gosh, so it's then I know they're not they're trying to do this because they love the island of Guam, and they're doing it. So for them to kind of sit there waiting for questions and stuff like that, it's also hard for them.
No, that's what I'm saying. Like, you talk about transparency, you could have had one press conference with these people, another with these people, one on the homeless.
When's the last time you guys have had a briefing with the governor through Zoom?
For the mayors, just that last time that we've talked, I think weeks ago on that end. They update us regularly on it. One of the things that they're trying to do is for the mayors is we're actually asking for the Guam EPA, the recycling revolving fund money to be released, so we can actually start just collecting. I said, best time to do it. People are home; they have time to clean their house, and just, we tell them ahead of time, saying put out the white goods, stuff like that. So that's something that we sent up the ladder to get requests to see if we can kind of get that done. And so it's a matter of getting EPA open to just sign the MOUs and the other stuff, and then we transmit what we need to. But we have our plan ready to go and ready to roll out. So we're asking for some sense of, give people some things to do while they're waiting for the rest of the government to open and the rest of the island to open. It's, offer this out there and just kind of get it done. And we stand ready to do it, because our worry is as we get closer to the summer months, and then it requires that all purchase orders start to be closed down and accounting needs to reconcile and everything, we miss an opportunity, or we end up rushing from, June, July to collect these things, because by August we have to shut everything down. And so it's hard to do. So it's a waiting game for us, and we're just waiting to see. And then even with the revenues of Guam, what it's going to look like for the mayors and our programs moving forward is, where do we lie as Mayor's Council as a priority? So we're trying to make sure the legislature still says, okay, this right now it shows that villages, because everybody's at home, they're seeing the work that's getting done. They're seeing the grass being cut. They're seeing the things being maintained. We're trying our best what we can here, but with the lack of sports and other things, it's hard for the kids too. So we may need to get more activities up and running during that summer months.
Since the beginning, the onset, I know that the mayors have been demanding more transparency from the administration and public health in terms of where the positive confirmed cases of COVID were located in and in what village. And so the dashboard came out, and now we're seeing information from the Joint Information Center about previously recovered patients retesting positive and have returned to active status. Have you guys been informed if they are, what villages these retested positive cases are located in?
No, we haven't, and I know that I believe it was Mayor Ernie from Maritso raised that question the other day about, can we find out who we're at, and so can we get some more information from that? So, and then I think when that video of the lady being released, came out from the GMH one, we were like, okay. So I said, wow, she's willing to be released. To video it and showing like, hey, look at me. I had it. So I said, isn't that something we could have asked all the others, saying, hey, would you mind if we share your village so we can inform? I think they would be good enough to say yes, because it would serve as a warning to the other neighbors that you can catch it anywhere.
Right.
Let me be that. Let something good come of this in a way. But I don't think that was ever offered to them, because I asked. I said, how did you get her to agree to be on video? Oh, we asked her. I said, you couldn't have done for the other hundred some. And say, hey, you know what? Can we just tell the public what village you're from, so it can help us with the message? It was an interesting. We haven't got an answer for that, but we said, that's what we just flat out said once we saw the video. I'm like, that basically says that she's putting her picture out there. We just wanted a village,
right? Yeah.
So, what was the response to Mayor Ernest?
I think it's just everyone's they're gonna find out, get the information. Like I said, it goes to JIC, and then JIC forwards it to a representative who represents it to public health, who then sends it back to chain.
It's like one of those like.
It's kind of like what we go through on the daily as we try and put together the show, and you have to get approvals before we can actually have people on, and then when you call them directly, it's like, did you get approval from the JIC? Come on, you can't speak
like
for
you're
yourself.
A grown-up. Yeah, I can't talk to a director without getting approval from someone half his age.
Yeah, no, I don't think in this day and age nobody wants to misspeak, so they're trying to just do what they can on their end. But it's the agencies that are open. It depends on what capacity and who's playing what role now. Because I think they're I would say they're stretched thin, but I know there are people in acting capacities who are from different divisions who are doing certain lines of work. So that's, I think sometimes that's when we send up requests, or when we end up calling, they're like, oh, buddy, I'm just the person answering the phone. I actually come from this division, and or I'm like, okay, not a problem, but they we'll find out who it is. So everyone's trying to do their thing. I think for public health specifically, I believe they transferred like several of those different lower departments to assist the tracing section, because I've talked to people who originally work at WIC or work at a Bureau of Social Services for child welfare, and they're like, I said, why are you answering the phone? They're like, oh, I'm temporarily detailed here to help with this. I was like, okay. So I understand, that sometimes the person on the other end of the line may not be the person who that's their specific job, and they end up getting told to do it, they say it rolls downhill. So they're like, okay, you find an answer for this. They're like, well, I'm an accounting person.
Hey, how's Mayor Savares? We haven't heard from her since that. There was a leak of a chat that she had put in a WhatsApp group about, I don't know how she felt about it, if she was embarrassed about it. I really wanted to. We did commend her. Like, hey, they were saying they want to test everyone, so she had put it out like, hey, come and tell people to get tested, and just say they have lost a sense of taste or smell.
Prior to that, that little snippet of what's shown us, we were talking about it. It was something we've been asking for. The Agate mayor has been asking for it to be done at Agate. We were asking for community-wide testing and all these things. So we understood. We knew. We didn't misinterpret her. We joke there all the time on different things, but on some of these issues, when we do talk seriously, it's like, okay, we understand what her intent was and on it. So none of us thought of it as being ill or saying, hey, you know what? If you had the fever the last 2 weeks or the last month and you thought you had it, go get tested. You know, you may be asymptomatic, or you may still have it, or a family member in your household. So just go, take advantage of it, go, because there's no line right now, and there's, you know, that we understood that. And, you know, when we talked, you know, when she said about having no taste and stuff like that, like I responded right after that. I said, I have no taste in decoration. Does that count? And, you know, people laughed.
Oh, Lordy.
That's how we kind of banter back and forth. But we understood what it was talking about. It was never any kind of like to be corrupt or bad or tell people. So we said, so we just, it
was our way to rapidly evolve.
Yeah, so we're just like, okay, and, you know, we kind of deal with things in our pace. And so we said, okay, we'll try to do it. And we talked about, can we get more sites? And then sure enough, a few days later, they announced, okay, we're going to do the North, Central, South. And so it was just us being who we are. So we haven't found out which mayor did it, but we're not bad or have any ill feelings. We're like, oh, who did it? Who's in trouble? So we were just like, okay, carry on. Let's do our jobs.
Yeah, but Mayor, yesterday we had this guy call up from Talafofo. He's in the quarantine at Pacific Star. And you know, he just made this whole big deal about, Tony Babauta was able to just get assessed and leave and go. And so he was saying, hey, if I'm in this quarantine facility, why don't you guys just test me? And if I'm negative, you know, send me home. If I'm positive, I understand. I'll be locked down for the 14 days.
Yeah, they test everybody in that facility that came off the plane. Now that they have the capabilities to do it, and you know, do it and save some people money. And you know, the guards, the marshals, the policemen who are all guarding those places.
Right.
I think they would prefer just we can close this one site down. We're not getting new flights in with massive amounts of people. So.
Yeah, you got to wonder. I mean, we've got all these. I had a list here, all these different properties, and you know, I don't know if some of them are still being used or.
We're talking about Wyndham.
So we have Wyndham Garden. There's also a Days Inn, Pacific Star, Santa Fe was used at one point, and Perlis Court, which is not a member of the Guam Hotel Restaurant Association. That's kind of a weird one, just off on its own.
What is Perlis Court being used for?
I don't know. I don't. Think
we have to ask the chief procurement officer, legal counsel.
Yeah, I don't think it's all quarantine passengers. I think some of them is also for medical staff.
Right. Yeah.
That so they don't go home. For those that are direct contact.
Yeah, that's the one that no one knew about. None of the nurses or anything knew about that.
That was only for like the SNU, SNF.
Yeah.
Yeah, so I think I know they're kind of spread out here and there.
That's just kind of a weird one because we know that they were working with a GHRA in the beginning, but then you have Perlis Court, which is just basically somebody's little condominium complex, and so you got to wonder: is there like how did they even get involved with this? Is it just a connection with somebody, or
is it closer? Yeah, I think it might have been closer to the hospital, but we will never know until somebody from procurement tells us. Like what it was for, but you know.
Well, not even the people from procurement. I mean, they're not even. It doesn't even seem like they're involved with the procurement of the procurement.
Yeah, but I
whose
think
job is it to procure?
Yeah, I mean, where's Claudia Foggi? I feel like they got her tied up in duct tape in a closet somewhere. I just get that visual, and then you know the governor's chief procurement officer, son-in-law / legal counsel is just running around.
Or she's social distancing. Like
maybe she's doing the political distancing.
Yeah, but like I said, it's depends on how many people are back at work. I mean, I don't even know how many people are working down at Adelup. I think a few are still at stay-at-home status. So that environment's a closed environment as well.
Why don't they get the chief procurement officer Claudia Foggi out here to talk to the people? It's just weird. It's like you have this super crazy crisis. God, I just said super crazy. But you have this. You got this crisis going on, and like nobody wants to come out in front of it and call up, you know. But we're getting Carlo and John, so obviously we're going to ask them a little bit more about it. But I'm wondering, you know, in the press conferences, and you know, there's some extra opportunities that are being afforded. If that's, you know, still, I think the media still wants to ask about it.
Yeah, and I think they should. I think have a separate one specifically to answer in detail what you have all been asking and what we've all been wondering.
By the way, have you heard anything about any new wave of community testing?
No, not right now. I know that it has ended, but there are requests. I know that they're trying to do the pockets. I believe the apartment units was that was something I want to say it's either Dedado or it was Tamuning Mayor who made the request for the Hemlani ones and who put that out there about you know some of these pockets and these larger complexes. So they are working with the mayors to kind of identify that. But it goes back to what villages, and we can kind of identify these pockets of these areas, and then we can kind of do the testing there, because people were concerned at the time about the amount of time allotted for these community testing. It was, I think it was 3 hours was my Nilao.
Right.
And, it's like, can you really test how many people in 3 hours? So people were a little hesitant to go up there. But now that some of the clinics are doing it, and then I think just flat out, I don't know if the federal government has agreed to pay for all the testing or coverage, or if your clinic, like if you're a member of a clinic, you can go and say, I want to be tested for COVID, then, and it's 100% covered. There's a way to bill it and get reimbursed to the clinic. I think people should take advantage of that. Since they're already on the road, hey, pull in and take a quick, test. I think it takes 10, 15 minutes to do. They ask you a few questions. They jam a long Q-tip up your nostril, or
it's smart.
Cough really hard.
Yeah. So I wonder. We haven't heard anything, right?
Right. All I know is
I think that was it. I think
when we
just
spoke to Linda last week, she said that they were going to do the testing at the Himlani Apartments and Maurizo over here in Harmon, and I forgot what other village, and then they were going to go to Guma Tranquilidad and to St. Dominic's.
Right. Yeah.
But we haven't heard anything from Linda.
I think St. Dominic's is what I think is. St. Dominic's and Guma Tranquilidad are next. I remember seeing that either in a chat or an email chain saying that they're going to focus on some senior care facilities and areas. So
I think if we have the capacity, why not just go out to the same locations this week and just do it again?
Yeah, until people kind of get their results and they feel okay.
The more you normalize people being tested, the more they're going to want to go out and get tested.
And
it's good. I think one, it shows I think people. It's always good to get any kind of medical checkup, so maybe it'll help the people kind of do that. I think on Guam we take for granted our health a lot. People don't go to the doctor until they're sick. They don't get annual physicals and all these things. So for them to be concerned about COVID, it's a good thing for them to kind of now say, hey, I'm going to get checked by a doctor. It's you want to go get checked by COVID, for COVID, but if you're out there and you have a bad goiter, or you're walking in with bad gout, I'm like, I think you should also get your gout checked. So. I take advantage of doing that and going to the clinic and just ask for those. So for those that are at clinics already getting regular testing, if the federal government is covering the test 100%, then just get it as an additional test while you're there.
Right. And even, just for the Himlani Apartments, I know that they were saying that they wanted to go out and test these vulnerable populations that don't necessarily go and take care of their health, but zero tested.
Transportation issues. Yeah.
Zero tested positive over at the Himlani Harmon Apartments.
I think what we should do, since we had those 2 homeless cases, is test everybody that's getting that goes to the kitchen. The Kamali Karda, the homeless ministry.
Yeah, you're right. They were supposed to do the homeless
population. There's 70 of them there. 70 plus people there. I would do that, and then I would also do the ones that are taking it. That also participated in the Gumamami Homeless Drop-In Center in Tamuning. So I think that would ease their mind too, because they're dealing with a lot. They're stressed out. I know that the kitchen's pulled back on some of the hot meals served. So I think they only serve Monday, Wednesday, Friday now. So I think that they're under a tremendous amount of stress. There's nobody out there on the roads where they can get money. Money's tighter. So I know they're a population in need.
Right. Well, and speaking of in need, have you heard anything about what's the deal with this homeless shelter after Paseo was scrapped? Project Safe Haven?
I probably would refer you to talk to probably Ray Tapasha at Gura to kind of get some more details on this. But from what we understand is that they had all the key reps that needed to be there, and then I think that they sent out their final plan to CDC and WHO. They were told, this is not you should do it this way. I think public health,
which is a kind of it's a shame, Mayor, because how long we were working on this plan and no one thought to run it by and make sure that we're going in the right direction until like the day before.
And I think that responsibility lies on if it was a medical response issue, that would probably be a public health thing. If the facility required medical staff to be stationed there, and there wasn't enough available, then that's something public health should be able to address, because they were at the table, I think, in the planning of this, or another group or another set of volunteers. But I think Paseo got a fresh coat of paint inside, and so and they kind of cleaned it up a bit. So
hey, if anything, there you go. That's a benefit.
That's a benefit.
Right. Baseball players are happy. Okay, and Mayor, thank you so much.
All right, take care.
Thank you for your report, and say hi to Mayor Melissa for us.
Will do. Thank you. Take care. Bye.
All right, Sinania Mayor Robert Hoffman. Hey, we're going to take a break and come back with Daphne Shimizu from the Department of Revenue and Taxation. with the first of what I anticipate is going to be some good news coming out today. 7:10. It is the 5th day of May. Guam's favorite, I-94. Okay, and Mayor, thank you.
Be healthy. Be informed with ITD.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
Be healthy. Be informed with ITD. On Giving Tuesday now, May 5th, 2020, the KUAM Care Force, in partnership with 7 Day Market, is challenging the community to the Get One, Give One challenge. On this day, we ask that shoppers consider adding a non-perishable food item or items to their shopping carts and make a donation to the Salvation Army and the Catholic Social Services while shopping at the 7 Day Market in Zonia or Harmon. After purchasing your donations, drop them at the designated in-store area. It's an easy way to show a family in need that you care. We can all do our part on Giving Tuesday now on May 5th. Be healthy. Be informed with ITD.
Seven 18, KUAM News Takeover, Guam's favorite, containing COVID. One day. Kind of been waiting for this day. The federal government has approved our stimulus payment plan. And so let's get Revenue Tax Director Daphne Shimizu up onto the show. Good morning, Daphne.
Hi.
Good morning, Sabrina. Good morning. Good morning, Chris.
Okay,
so some good news.
Yeah, let's get right to it.
Oh my gosh, this is really great news for our people. And as you know, as you said, this is something that we've been working on for a while. So early this morning, I got news that our implementation plan was approved by the IRS and the Treasury. That's great news for our island. I want to just thank our people for being patient. Of course, you know, we're still waiting for the funding. The IRS and the Treasury have assured me that they're working on providing the funding as soon as possible. And so that, you know, will happen soon. You know, again, I just want to say thank you. And if you don't mind, do you think I can just share a story that I think is very perhaps relevant, and I hope maybe for me it was inspiring?
Mm-hmm. Of course.
So, you know, over the weekend on Saturday, of course, we had, you know, Santa Maria and Camelin was being brought around our island. And, you know, early that morning, my husband and I, we went to grocery shopping, and then I was putting food away, and I got a message from one of my team members, and she says, Daphne, we're going to be outside Reverend Tax, you know, to be there to witness as Santa Maria passes by. And she says, and, you know, and that's expected to be at 10:40. So I said, okay. So I drove up to Reverend Tax and sat in the parking lot, and it didn't dawn on me until I was sitting there that, you know, that Santa Maria and Camelin was scheduled to pass by Reverend Tax at 10:40 in the morning. And I mean, I didn't get the connection, but I thought, you know, what are the chances she's going to pass by at the time that's like directly correlated to when you think about income taxes at 10:40? And so at that time, I also was communicating with IRS, and I want to share with people when, you know, over the weekend, I was able to witness Santa Maria and Camelin, you know, pass Reverend Tax with my team, and then again in Jonia with my family, and then again in Marisa with my father, because I didn't want him to be alone. And I just believe that, you know, that was great hope that was it was just so moving to see a lot of people on the side of the roads just waving these like white handkerchiefs and napkins and papers and whatever it is that they could find. For me, I just really believe God is here, and I really believe that God has been with us and guiding us, and I ask him always to pray for or to guide us, especially as we make decisions. You know, I will tell you, as we've been working on this, we've always done our best to have our people's best interest in mind. You know, I'm from here. I love Guam. I love our people. I'm so grateful to both of you as well. You know what? I have to say, you know, thank you for getting me on right away to make sure that we let our people know about this. You know, Reverend Tax has been working so hard. My team was activated since right after the CARES Act was passed, and they were activated so that we can make sure that these payments get out to you, to our people here. And, you know, again, this is so important to us. So, you know, I want people to have hope. I want people to know that we are going to do our best to get these out to you. I promise you, this is so important to me personally. It's important to our team, my team here at Reverend Tax. And can I just say thank you to them as well? Do you mind if I say thank you?
You got the floor, Def.
Okay, so we have, you know, of course, we have our team of supervisors that's been up there like every day, including the weekends, and they work so hard. We have Nora and Norma Jean and Rose and Jean and Paul and Jerome and Craig and Larry and Marianne and Jason and Edmund and my partner, who I love, Michelle. She's been like one of my probably dearest friends for many years, and you know, she's been there to support me and to help get through this. So I just want to thank my team, but I also want to thank our people and thank them for their patience, and I want to just let them know that there's hope, and we're going to get these payments out to you as soon as possible. I do want to say though that you know, since the beginning of April, you know, when Governor Leon Guerrero did announce about the EIP, she did mention that, you know, within a couple of weeks from the time the plan is approved is when we'll expect to begin mass payments. And so, you know, the plan is approved today. And so, again, that's really, you know, I know people have the question about when, and that's really our answer this time is, you know, within a couple of weeks from now. You know, I don't have a whole lot of details. I've actually started work since about 2 or 3 this morning, so I was working in my pajamas and communicating with the IRS and get the media release out and trying to make sure that I got the information to all the media outlets. You know, I let Chris know. I try to let the other media outlets know. You guys are such great. They're so great at getting the information out. I really, really appreciate it from the bottom of my heart. I will share with you that I know people listen because, you know, as soon as the non-filer form went out, you know what, and the EIP email address went out, like on the first day that we put up the EIP address on a Sunday night, and by the Monday night at 11 o'clock, we had 221 emails.
Wow.
And our team did their best to answer all of them, but, you know, we're doing our best to get the information out to the community as quickly as we can. And again, I can assure you, you know, I love Guam. I love our people. I'm here to serve. You know, I'm very inspired by my own team who have said to me, ma'am, we're public servants and this is what we do. And, you know, again, you know, we're here to serve our people, and we're going to do our best to make sure we do that. And I don't have a whole lot of time because I have to get back to my team. Actually, I have to get to the office so we can work on getting the guidance out. But if you don't mind, can I share a few items which my team wanted me to mention? So, you know, we want to remind people of a few things. One of them is please make sure you sign your returns when you put them on in the Dropbox or when you send them in the mail. We're finding that some people are not signing their returns, and that when you don't sign your return, it's actually not considered a completed return, and we're going to have to contact you somehow to get you to sign it. So those will not be considered valid. So before you submit, make sure that all of the information is complete. If there's attachments, that those attachments are complete, and that you definitely sign the form, because we will not process it if it's not completed. And that's really important. You know, Norma Jean, who is she's our customer service supervisor, and is probably one of the most patient people I've ever met in my life. She says, can you please make sure you tell people this? So the other thing is if you filed the 2019 or a 2018 tax return, please do not file the non-filer form. That non-filer form is only for people who are not required to file for those years. And the other thing that's happening is people are trying to email their forms to us. You really have to utilize the Dropbox, or make sure that you send it to us by U.S. Postal Service mail, or if there's a payment, pay it at the Treasurer Guam Cashier at ITC building. But Sabrina and Chris, again, I want to thank you.
I just had just one question. I'm so sorry. We had someone had commented, some people who made 10,000 or less haven't gotten a stimulus check. And then there's also this person says they know someone who made over 25,000 and they received a stimulus check. What can you tell us about that? And are there people still waiting for the advance payments? Or are we done paying those out?
We're basically done as far as I know, but I will tell you the best thing to do is for those individuals, if anybody has any questions, we do have a call center that we set up. We actually stood up a call center within the last couple weeks in anticipation of the implementation plan being approved. So please make sure you call our call center. The call center numbers are in our media release at 635-1840-4142. And so we have like about 6 or 7 phone numbers that you can call. But because we really experience a very high call volume, if you have any questions at all, please email Guam EIP, that's GUAME like Echo, I like Igloo, P like Papa, at revtax.guam.gov. And again, I just want to say thank you to the DRT team, also to the DOA and Treasurer of Guam teams, to our whole fiscal team, to our administration for the support. And, I really appreciate all the support that our governor and lieutenant governor have given to me and our team. And I also appreciate all the media for just being really supportive as well of our team. You know what? You guys actually have been so great. And my team loves to listen to you guys in the morning.
Thank you, Daphne. And when you say you appreciate all the media, you mean that you appreciate us the most, right?
Well, you know what, Chris, I did tell you I couldn't be on at 7:16 because, we have created kind of a prayer group where we pray at 7:14 and 7 in the morning and 7:14 in the evening, and that's because of 2 Chronicles. And so, you know what, I've been asking people, and if they can commit to praying twice a day, just some of my friends. And so I told Chris, I said, if you could just give me until 7:16, then I can get on the line with you. And he called me at 7:15, and I was right at the last line. That's why it rang so long. Right. But I always do my best to answer calls when I can. Of course, if I'm in meetings and other things, I will let you know if I can't. But, again, I want to thank you guys. I really, really appreciate, you guys getting out the information. I appreciate you guys putting our non-filer forum up and making sure that our community has the right information. The last thing, if I could just share with you and leave with you, because I know one of the big questions was with regards to Social Security recipients and Veterans Disability recipients, who will be paying those. So we just were able to clarify in the finalization of our plan that for all Guam residents, including Social Security and Veterans Disability recipients, those are going to be paid out of the Guam Division of Department of Revenue and Taxation. And so we will be issuing guidance very soon. DRT has been working, really hard in anticipation of the plan being approved to begin to put our guidance together so that we can release that within the week. We'll get those information out to all of our people. And again, I want to thank them. I want to thank our island. I want to thank our people and let them know that, I pray for our people. I pray for our government. I pray for you both. And, I'm so grateful to God right now. I just want to say I really believe God is here and he's really guiding us in everything that we're doing.
Well, you guys are doing a great job. We thank you so much for all the hard work you guys have been putting into this. I mean, you're definitely one of the shining stars in this administration. So, again, thank you.
Thank you, Daphne.
Well, thank you, guys. Have a great day.
God bless you. Wash your hands.
Take care.
Okay.
Bye.
Okay, bye.
All right. Daphne Shimizu, Department of Revenue Tax. And, they also just released a whole bunch of tax refunds.
Right. And, people are, I know that we have questions here that are going on in the stream, but as you can see, she's very limited for time. If you do have any questions, they stood up a call center at Revenue Tax. The phone numbers are 635-1840, 1841-42, and 635-1857. You can also call 635-7603, 04, and 06. There's also an email. Jason, you can see the press releases in the WhatsApp chat group, by the way. The email is guameip@revtax.guam.gov. Those are the phone numbers and the email if you have questions regarding the stimulus checks or I guess any revenue tax related question.
Right,
They've stood up a call center. Please give them a call.
Hey, and if you didn't get the under 10,000 advance payment, remember the stimulus money that is coming, and the checks, like Daph said, within a couple weeks, you're going to get that. So remember, the advance payment was for those who earn under $10,000. So I'm assuming anybody who didn't get it is going to be made whole by this mass payment of the stimulus money. So yeah, that's definitely some good news. Bree, do you have anything on the recovery patient? We played a video off of Dr. Tom Shea's Facebook page. I know we have the video on here, but I want to bring Jerry. He's the husband, and this video kind of went viral. I know it was on Dr. Shea's Facebook page, and
right.
We also
this was Friday night.
Yeah,
Friday night.
And this is and so I want to bring Jerry. Jerry, just good morning and thanks for joining us.
Good morning. Happy day, Chris.
Hi, Jerry.
So I guess
good morning.
First of all, that was just
Nadia Sajisi.
How do we say your last name, Jerry?
Sajisi.
Sajisi.
Yeah.
Nadia Sajisi. She's your wife, right?
Yes.
Nice.
Well, it's such great news. I mean, I saw it. I was trying not to cry. Is that my computer?
Yeah, it is.
Sorry.
Jerry, so we're just playing the video up here real quick. Just tell me, that was so emotional. I mean, 41 days in the hospital. What was it like for you to pull up curbside and to finally see your wife, pull up in that wheelchair and go home with you?
Well, Chris, I'm so happy and grateful. I just feel like we were really blessed, and I would like to take this opportunity also to say thank you so much for all the doctors, GMH doctors and nurses. Even the housekeeping and the guards there was so accommodating, and they let us know every day of what's going on with my wife.
That's good. How long was she there? When did she go into the hospital?
She was there since March 22.
March 20. Oh wow. Was she the one of the first COVID-19 patients?
No. There's I guess there's one there that's already been there, but she stayed at GMS for so long that sometimes I feel like this is really a struggle for me, knowing that I can't be on her bedside, but I was informed every day by the doctors and nurses what's going on there, and they try their very best to save the life of my wife, and I'm so thankful for that.
Mm-hmm. Do you know like how she contracted COVID?
We don't know. I'm still trying to go back to where we go and what our activities, but I can't figure out until now.
Mm-hmm. Did you guys travel recently?
Oh, it's been a long time already. We traveled, but I don't think that we got it there. Mm-hmm. I'm not sure where it, I can't really figure out.
Right.
Are you part of Glacier de Cristo?
No comment, sir. No comment.
Okay.
Okay.
I don't want to.
Okay.
Right.
No problem.
Yeah, it's okay. So, that must have been tough to not be able to be by your wife's bedside. Now, I know you said the doctors were calling you. Were you able to talk to your wife over the phone, or did you guys do like a video call?
FaceTime?
Yeah, there are times when she was already recovering, and they did their best to have me talk to my wife.
Mm-hmm.
And she was on a ventilator for a few weeks, right?
It's like more than 3 weeks, I believe. Yeah, or a month, something like that.
Do you have family? I mean, kids? I mean...
No, they were not there. They're off island.
They're okay, so it must have been really tough for you. Then you were home alone while she was at the hospital alone?
Yes, indeed, yeah.
Well, tell me how you got through it then, with support from,
Well, family and friends praying for us, and we are thankful for that. I think it's a blessing for us from God that He still gave my wife life, another life. Yeah.
Mm-hmm.
Can you describe the moment when you first embraced your wife? I mean, she's isolation. We all know how the COVID patients aren't able to see their families. But that moment, which is playing right now on our Facebook stream, just describe that moment for us, if you could, Jerry.
Well, it's overwhelming. I forgot everything except that, seeing her is like so long for me that never seen her. The struggle is over. She's fine. She was with me already, and I want to bring her home as fast as we could. That's how my feeling is. And so blessed and thankful for all those things.
What was that first night like at home? Did you cook her
dinner?
dinner?
Yes, I prepared something for her.
What'd you make?
Her favorite curry and beef stew. She likes that, so I did prepare for her.
I bet that was so good after 40 days of hospital food.
Yes, she did enjoy it.
And so, is there any follow up with public health or GMH with your wife? Do they still call and check how she's doing?
Yeah, they did. They kept calling us, and we have some follow up appointments with our doctors. Would like to mention all the doctors, but there are a lot of them that help us, coming with this.
You said your kids are off island?
Yeah.
How many kids?
I got one.
One?
Not kids only. I had one.
Okay. Did you guys do a FaceTime with Mom?
We did. Yeah.
Oh, how did that go?
Oh, it's emotional, like it's been long time, but very emotional. Both are crying. I cry too.
You're getting me worked up over here, Jerry. I'm an easy crier. I cried like 3 times on this show.
Yeah, I know. It's so emotional, and I don't expect that. We don't think about that. We thought it's just a normal discharge activity, but I believe that everybody was so happy that she survived, and with this professional GMH doctors and nurses and all the staff there. I think they were grateful also that they did their job well. So that's it.
Was there ever a point, Jerry, where you had a hard time finding the hope to keep believing that your wife would pull out of this?
There's some point, yes, especially in those times that doctors telling me something, things like that. But then again, I'm a person that believe in God, and He can do whatever He wants to. Yeah.
Well, I can only imagine, what you went through. And is there anything you'd like to say to the people of Guam about your experience, about,
Yeah, I would like
change
to
your
say
life?
Yes, I would like to say that, we have to follow government instruction or some kind of procedures, like staying home, wearing face masks, washing hands. All these things can minimize the transmission of the virus. A lot of things that we have to do, but again, we have to unite as one community and keeping everyone safe all the time. So maybe that's like we still have hope. We can overcome this. We are one with this.
Good words there, Jerry. God bless you, and
give our regards to Nadia,
yes,
your wife, and your family.
Yes. Thank you.
Thank you so much.
All right, so good to hear from you, Jerry. Let's give a big hand there. Wow.
Thank you.
We got a comment here. I don't care much for kari, but beef stew sounds good right now, Jerry.
Okay. Yeah.
I can do a little beef stew for breakfast, Thank you, Jerry. You're such a sweet guy. I know I called you. I was trying to set up the call with him, Bree. And I was like, let me, maybe around like 6:30. He's like, I'm cooking breakfast for my wife at that time. So,
what did you make for breakfast, Jerry?
Oh, just salmon.
Wow.
He likes
It's like whatever you want, babe.
Yeah,
whatever
right?
you want.
Good job, man. And hey, happy early Mother's Day to the wife, okay?
Yes, Chris, thank you so
Okay,
much.
Jerry, God bless
Take
you,
care.
man. Thank you.
God bless you guys.
Wash your hands.
Bye.
All right, 7:41. We'll take a really quick break, and we're coming back with we have the acting chief of staff for the governor, John Junior Calvo, and I believe the policy director, Carla Branch, coming up next here on Containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Tuesday now, May 5th, 2020, the KUAM Care Force, in partnership with 7 Day Market, is challenging the community to the Get One, Give One challenge. On this day, we ask that shoppers consider adding a non-perishable food item or items to their shopping carts and make a donation to the Salvation Army and the Catholic Social Services while shopping at the 7 Day Market in Zonia or Harmon. After purchasing your donations, drop them at the designated in-store area. It's an easy way to show a family in need that you care. We can all do our part on Giving Tuesday now on May 5th. healthy. Be informed with ITD. Be healthy. Be informed with ITD.
.47. Hey, good morning.
Morning.
I just wanted to play this apology for you guys again. Or let this rock a little bit. Shout out to Annette and Jeff Paul going. We're doing another great Stay Home Live Local Fridays this Friday. Who are some of the awesome artists we can look forward to seeing as we stay home and jam out, Bree?
Ben Ngalta's one.
Yeah. So we got Ben Ngalta.
Yeah, that's what I know so far.
We're working on it.
Jonah Gonchafris is actually producing that. So she's been gathering a lot of the musicians.
Right.
And I just need to get an update from her.
Right. So it's awesome. And I mean, they've gone everything from, show tunes to spoken word, of course, to, island style music.
Hey,
so
Heather Manley, I love that.
Yeah,
I thought that was
pretty
great.
cool.
Yeah. And she's very talented.
So, we had the Lieutenant Governor of Guam call into the show yesterday, and I really, if you're judging by the comments, it just, finger on the pulse of the public. I think that him coming out and, trying to answer some of these questions that, we had about the muting of the media and the, procurement of the quarantine hotels and facilities. And so he had basically apologized to the people of Guam. He said that he was going to expect an apology from the communications director, Janela Carrera, and policy advisor, Carlo Branch. And we actually got that apology from Carlo yesterday. I'm going to play it up here for you guys.
To say to you, Chris, that I think three groups of people are owed an apology. First and foremost is the reporters who participated in that press conference. The fact that I gave an instruction which resulted in them being cut off or them feeling like their right under the First Amendment was not respected is completely my fault. I should give better instruction, and I'm responsible for that. The people of Guam deserve an apology because we can constantly point to examples in our history of people who work for the government and think that they shouldn't be subject to scrutiny. And I never wanted to be one of those people, and that's wrong. And third, I extended my personal apology to the Lieutenant Governor and to the Governor. And the Lieutenant Governor had the strength and moral fortitude to apologize to the people of Guam on the radio this morning the moment he was asked the question. The fact that I had to wait for reporters to ask me the question shows that I'm not as brave and forthright as he is. So those who serve the Governor and Lieutenant Governor have to serve them well. And that day was not one of my better days.
Okay, well, let's see if what do you think, Carlos? Is today one of your better days?
I'm sorry, repeat that one more time.
Is today one of your better days?
I hope so. I try to wake up doing better than I did yesterday. I don't always succeed, obviously, but
I mean, who does?
I try.
So I guess, appreciate that apology. We had a lot of comments, and people were kind of saying that, why is he apologizing? It should be someone higher up. Do you anticipate that we might get an apology from the governor, maybe?
As you have told me on more than one occasion, the governor speaks for the governor. So I know that at 1 o'clock today, she will have a press conference on a couple of matters, and that she has agreed to take all questions for as long as they are reasonably given. So, I expressed my apology to her, to the people of Guam. The reason I took responsibility is because I am responsible. There is no higher person who is responsible. And I know, Chris and Sabrina, both of you have had management, and, usually the person who is responsible for the people below them makes the apology, and so I apologize to the governor and lieutenant governor, and I apologize to Chris, particularly to the KUAM family and to anyone who was offended, hurt, or made to feel like their First Amendment privileges under the First Amendment rights under the Constitution were violated. That was not my intent, nor was that my instruction, but it was the way it was carried out, and I'm responsible for that, given obviously my instructions were not clear enough.
But I mean, I guess you're responsible, for it to a certain point. But in that live setting, the governor could have at any time overrode your decision. But I want to just kind of go back.
I want to make that clear. I think she could have overrode my decision had she understood and had she known about the decision. But I made clear with you, I made clear with the Post yesterday, and I should have made clear with you that neither the governor nor the lieutenant governor were aware at any point. So, obviously...
Yeah, Carlo, but they were asked the questions and they didn't answer. So, I mean, I think that they need to also be held... lieutenant governor already fell on the sword, but let's be real. At any point, the governor could have said, no, they're asking a question. I mean, it looked like she knew what the plan was.
Sure. So I think what happened, Chris, and again, I take responsibility for it, is that what was told to the media beforehand, as I understood it, and I rewatched the tape yesterday before giving you my apology, was that, the staff did say that any question media had outside of those topics would be answered. So those questions were answered in writing as we had promised. So I think the governor's assumption was that we were going to get to everybody's questions, as we did, in writing in accordance with the ground rules that were set out. Now, what I think was incorrect, and what I do apologize for, is the muting of media. I think everyone has a right to answer their question. And if the response is, we don't have an answer for you at this time, but we'll get you an answer, I think that is fair and appropriate. But I do not in any way believe that it is appropriate to mute a question before it is fully asked. Now, sometimes there are technical difficulties, and we generally try to remediate those. I know that when the first question was asked by the KUAM reporter on Thursday, either the mic dropped out or the mute button was inadvertently hit. I don't know which one. And then she was able to come back on and finish her question. But I think she was...
But she was also not given the second question, Carlo, right? According to your ground rules.
Instances, that was wrong.
Yeah. See, she also wasn't given a second question, so you guys, muted her, let her finish asking the question, said, no, we're not going to answer that, and then she never got that second opportunity.
Right, and so obviously I have admitted that was wrong and that was poor execution, and there are no excuses for it. And today at the press conference, the governor will take everyone's questions for as long as there is reasonable time.
What is reasonable time? Because as far as I understood, that you guys were offering one-on-one interviews for every single media after the press conference.
Sure. So I think I let I don't know if it was Chris and Mindy, but several media have asked us for one-on-one interviews. So it was also an opportunity that we gave to KUAM and others. Some people like to ask their questions in groups. Some wanted to ask their questions individually, on camera or via Zoom. So that was an opportunity. But we had always said that we would take questions at the press conference relative to the subjects of the press conference. I had also made
clear that was not always said. That was just one day on the recovery plan.
I'm sorry.
Okay, you can see our frustration, Carlo, is that when we don't have an opportunity to ask questions, or when we do and it's a one question, one follow-up, you're muted on the answer, so you can't come back and say, hey, Governor, you didn't really answer the question, or wait, could you clarify that? I mean, to defend this, the whole process of these Zoom press conferences, it's really a disadvantage for the media, because we're getting muted. I mean, you muted us Thursday, but you guys mute us every press conference. We're on mute. You know, we ask a question, we get muted. So I don't want to gloss over just Thursday because this is something that has been the norm. We're not afforded an opportunity to come back and say, hey, you didn't answer that question, or hey, that, you know, can you kind of explain that because that's not what so-and-so said. And so I know now you guys have decided that, oh, we're going to let you guys ask as many questions as you want, but I just want to say that it wasn't just Thursday. Mm-hmm. I mean, every time you guys set on a notice for this press conference, it says right there, reporters will be muted.
Sure.
And GVB had a thing, and they said, oh, please mute yourself. Like, you know, they actually treated the participants like adults.
So I want to make clear why that was done, so that you understand, you know, my thinking. And then I also want to make clear that that will not be done in the future. The reason that it was done is the first 3 press conferences, and each of you can go back and review the tape for yourselves. There were specific instances in which the person who asked the question before the current questioner had not muted themselves, and it caused feedback in each one of the broadcasts to the point that the person who was currently asking the question could not be heard. And so we were advised, even by some members of media, that when a person finishes asking their question, they should be muted from an audio perspective so that the current questioner is not interfered with. And so, you know, when the instruction to mute individuals after their question had been fully finished was given, it was not in an attempt to abridge media. It was an attempt to be fair to the next questioner who had a right for his or her question to be fairly understood.
No, I get the, you know, coming from an audio and production, but I get the technical side of it, is that, you know, people were talking over each other, and you're right, the first couple were rough. But again, I just got to say that when we ask the governor or, you know, Linda or whoever's in the press conference a question, and then you're muted, they throw out their answer, and there's just you can't respond, you can't. And in a normal interview, and I know these aren't normal times, but in a normal interview, I would be able to say, hey, Governor, can you clarify that? Or, hey, you didn't really answer the question. Can you go back and maybe address it more specifically? But again, that opportunity is not being afforded, and then so we're stuck with these half answers sometimes, and no opportunity in a real setting other than a text message to get more information on it.
Sure, and I am clearly apologizing for the way things were done, and we are trying to adopt a policy that does them better. The idea behind the follow-up question was so that the main question could be clarified. I also understand that that is not enough time to ask for a full and thorough answer, and that's why there will not be time limits artificially placed on today's press conference. But the reason that was done was to balance out the fact that for the first time in a long time, as many as 6 to 8 media are asking a question and a follow-up. That's a total of 16 questions. And so none of this was done in an attempt to limit media or media scrutiny. If we wanted to limit media scrutiny, I don't think we'd have press conferences every day. And I know that, I just looked at it last night. There are only 2 jurisdictions that I can find that have done press conferences as often as we have done them. I will clearly admit that we are not doing them as well as we should, and we have always said publicly that this is a process where we hope we get better every time. And so I admit that, that there was a clear failure on our part last week, and I admit that we can and should do them better, and that's why I'm here talking to each of you as a man, taking responsibility for what went wrong and trying to adopt a way where we do it better.
Okay, well, we feel so lucky to have these press conferences. Thank you so much.
Yeah, that's kind of ridiculous, Carla. I mean,
all right, but just moving forward for today's press conference,
that's
because I know there were
one.
Discussions about let's do this one-on-one interview with the governor, with all the media. She has all the time to do that with, what did you say, 6 media that are on Guam, and we suggested that we don't need to have a one-on-one interview when we could take the time and do it after this press conference so that we don't have to create an entirely new Zoom conference because we have her. And that's something that I discussed with Mindy from the Post.
Sure.
And it's something that we are willing to do. So I just want to make sure that during today's press conference, everybody gets their one question, one follow-up. Are you extending the press conference so that we can have our interview with the governor?
So,
or is it you only get 2 questions, boom, we're done?
No. So as I said, the governor will take questions for as long as there are questions. right? And so, I'm willing to take we're willing to take suggestions from you. The original way that we thought maybe we could do it fairly was everybody gets one question, one follow-up for as many rounds as there are questions. So, if there is A, B, and C, you still go in order A, B, and C, but we do as many rounds as there are questions. And if one news group doesn't have many more questions, then they're out for that round because they've chosen to be out. And if KOAM and the Post have more rounds of questions, then they alternate turns until such time as those questions are exhausted. And so I was going to, send out a question. I was going to ask Janella to let people know that is how we were thinking of doing it, so that one person doesn't ask 12 questions in a row, and maybe, it isn't as fair for everybody else. But we're thinking of keeping the round system with a main question and a follow-up for as many rounds as you have questions. And so, Bree, and I just want to make clear that 30-minute interviews were not in an attempt to, abridge anyone. Separate media, other than KOAM and the Post, asked for 30-minute interviews after the press conference or beforehand. That was an offer on our part to allow for equal time. Obviously, because if we had given your competitors 30-minute interviews with the governor alone,
I mean, the governor does that every morning, though.
I'm sorry, you could then be with me the next morning saying that we had not offered you the same opportunity.
Right.
So that's all I mean.
Okay. So I guess we'll ask all our questions during this press conference this afternoon while we are live, and we don't have to establish a whole nother Zoom conference.
Sure, and if that's I can obviously that is a choice you can have, and we're open to that. So the governor will take as many questions as there are questions to be taken. And again, I am personally sorry for everything that happened last week. We are trying to do better.
Mm-hmm.
I understand the frustration and anger that you have, and we have a job to do, and that is to try to navigate our way through this crisis, and we respect that you have a job to do. And I've been here taking all of your questions. I will continue to do that. I've never dodged either of you.
Carlos, stand by. We're KUAM FM, Hagatni, Guam. By the way, thanks for jumping on to our KUAM TV 11 broadcast. It's the KUAM News Takeover containing COVID, Guam's favorite I-94. Sorry, brother. Okay.
The lieutenant governor, he was first. He came on the show yesterday. He apologized, and he said that, you would be apologizing. Are we getting an apology? Is the people of Guam getting an apology from the communications director, Janella Carrera?
So, Janella can... I am responsible for it because...
Okay, so that's a no. All right, thanks.
We just anticipated because she's the communications director, and clearly this was a communications issue.
Sure, and Chris, I know that Bree didn't find that answer satisfactory, but I just want to explain.
I don't think the people of Guam find it satisfactory.
Yeah.
I'm not speaking on,
It's
Bree
not
knows
really,
everything. No.
It's not really us, man. It's just the people, and the comments, again, going off. It's really pretty simple. Ask one question at a time. I guess they're referencing your explanation for why reporters are muted in the first place. It's just a bonehead decision, Carlo. I don't know any other way to put it.
And I am taking full responsibility for that bonehead decision.
Right.
And it was under my instruction, and those instructions did not get implemented well, and that was my fault.
But again,
so
I think also
I don't ask for other people to take responsibility for errors in my judgment, and and that is why I have apologized, because I was in charge. I made the call, and I am apologizing.
All right, so let's move on.
Okay. If you have any other questions, I'm still here.
Yeah, I wanted to know, the governor's son-in-law, Attorney Haig Hewen, the legal counsel, is he the chief procurement officer for the government of Guam?
No, ma'am, he is not.
Okay, so what is his role in procurement for the COVID response?
So his role was to negotiate contracts on behalf of the governor using her emergency power under the public health crisis statute.
The public health crisis statute?
Is that
public health emergency statute under Title 10?
So, Carla, let's just go back. When there were other typhoons or disasters, was it always the governor's lawyer who facilitated and organized all this stuff? So, for example, when there was a storm during Governor Eddy's time, Was it Arthur Clark out there, procuring stuff, or because
Arthur Clark's role was as chief policy advisor. He was never legal counsel.
Okay, or the legal counsel.
Governor Calvo had various legal counsels at different points, so I do not know how.
Is it normal though, Carlo? Because I feel like we have a chief procurement officer, and so I just want to say, is it par for the course for the governor's legal counsel to be out here procuring all this stuff? Under what authority? Is it just because he works for the governor?
Sure. Let me answer both of those questions directly. Under what authority? Under the existing statute, Title 10, relative to public health emergencies. We have said, more than once that the governor has the authority, in order to respond to an emergent need, to suspend or to suspend a rule or statute, and that is because that public health emergency power recognizes in some cases that the traditional method of law does not work to respond to an emergency quickly. So, as an example, I remember waking up on a Wednesday morning, reading in international press that President Duterte was throwing out, or ordering the removal of all foreigners, including returning residents to Guam and people who are transiting through Guam. That happened, I believe, on a Wednesday morning. That order was effective 72 hours from that point, so, around Saturday morning, Saturday afternoon. At that point, the need to expand quarantine facilities was emergent and expedient and absolutely necessary. So the governor has invoked under Title 10 her authority to abrogate particular statutes in order to respond to this pandemic. That is the response to the authority question. Number two, what is the appropriate role for legal counsel? In this case, legal counsel negotiated the terms and general need for these quarantine facilities, and he did so at the instruction of the governor. And the governor has the authority to do that, most especially in an environment where traditional procurement law does not apply, because under Title 10 you have a public health emergency. For example, clearly those of us who have history in the government recognize that it takes more than 3 days to negotiate any contract. In fact, average contracts may take more than 3 months. In fact, the contract for telephone services in the government of Guam was in negotiation and procurement hell for 10 years. So the idea that you can use traditional procurement with all of its restraints to respond to an emergency in which a foreign president says all of your residents must be out in 3 days isn't practical, and the law recognizes that fact.
So this isn't something that the Guam General Services Agency, Guam Home Security, Office of Civil Defense could not handle? Because I thought, according to the pandemic annex, that GHS OCD is responsible for procurement.
Yes, ma'am. But again, remember, I mentioned to you that under Title 10...
I get it. She gets superpowers. But I'm just saying, using those superpowers, wouldn't she designate it to people who have experience in dealing with the emergencies, such as Guam Homeland Security and Office of Civil Defense, which is included in the pandemic annex of the Guam Emergency Management Plan? Which, didn't you help write this?
I did help write it in 2008, yes.
How much experience does the governor's son-in-law legal advisor have in terms of procuring during emergencies?
Like many attorneys, he does not. I want to make clear, he is not procuring. He is, involved in the negotiation and framing of agreements, which was something.
Actually, I think there was an email. He said, "I have already procured." Was in your story, Bree? He said something like, "I have already procured these items, waiting for the necessary documents to catch up later." So in his mind, he's procured stuff.
Sure, and again, remember, lawyers think of the word procurement differently from you and me. I think when we are thinking procurement, we are thinking the traditional procurement process. And I don't want to speak for him.
We should just be able to speak. I mean, he can't call up Carlo and just answer our questions?
I can't speak for anybody but myself, Chris. You're asking me questions, I'm answering them.
Okay, so since you are speaking for yourself, Carlo, you're the chief policy advisor to the governor of Guam.
Yes.
You helped write this pandemic annex, and it says
yes.
In 2008. Well, this says December 2016, so I guess 2008.
I wasn't involved in any of the edits. I wasn't a big friend of the administration in 2016.
Okay, so in 2008.
Yes.
And you just said that, yeah, you helped write this, and it does say that GHS, OCD would be responsible for procurement during a pandemic. Did you, as a chief policy advisor, advise the governor that, no, we should probably follow this process, stick with the pandemic response plan, go to GHS, OCD, and handle procurement, as opposed to her saying, I got superpowers, Title 10, yes, let my son-in-law handle that?
Okay, so relative to 2008, I can tell you that in 2008, relative to the pandemic response plan, that it was contemplated that a governor would need to invoke her powers under Title 10, and that at certain points, depending on the type of pandemic, the governor would need to use extraordinary authority, and that is why she has it. And it is because even under the existing processes for Homeland Security...
You said contemplated. Was it put in writing in the plan that you helped write?
It need not be put in writing at that point because those statutes were already in play, right? That was authority she already had.
So why have a plan?
In 2008 had, so Governor Camacho and...
So why have a plan if we're not going to follow it?
Yeah, Carlo, I was talking with someone who's got a lot of experience with the EOC a couple days ago, and their take on this whole thing was that this should have just been run through Homeland Security, Civil Defense. Now, we've seen the emails from Charles Estevez to Lester Carlson saying, hey, just heads up, some of this stuff doesn't jibe, and we've been told that FEMA is now saying that the way things are right now, we're not going to get reimbursed for it. So clearly there's a problem. Your own lieutenant governor said that this whole procurement raised red flags for him. And he's got experience with FEMA. He's got, experience with disaster procurement.
He's a former GAR.
Yeah. I mean, well, you're saying one thing. We just have a chorus of many other people, including sitting senators, who have major problems with this procurement, not procurement.
Sure.
So let me just ask you, is there any accuracy to the statement that are there any funds that need to be certified through Civil Defense or Charles Estevez? And what can you tell us about these funds being? Is there any issue with somebody not wanting to certify funds?
I'm sorry, I don't know that. I don't know that I clearly understand the question. If you could repeat it.
Do these contracts need to be certified by Charles Estevez? Any funds that are going to be spent for COVID-19, anything that is procured, does it need to be approved, signed off on by Charles Estevez? Is he the GAR? Or that was Tony Babalza?
It was Tony, yeah. So who's the GAR now, Carl?
I'm not 150% sure on Charles's exact role under federal law, so I don't want to comment on something I'm not an absolute expert on.
Right. But he kind of seems like he knows what the process should be, and I think that if you look at the emails with him and Lester, he's saying, hey, there's some things here that aren't, following the FEMA procedure. So how would you, I guess that would be the question. How do you respond to these comments from people that this whole process is not going to, as it is right now, is not going to stand up to the federal scrutiny for reimbursement?
Well, I would say that I think that this process, when it is clearly looked at by an unbiased third party, whether that's a federal auditor, a local auditor, or a FEMA reimbursement person, I think they will, in reading local statute and federal rules, understand that this process does pass muster, was unique, and is consistent with law.
Title 10.
Do you guys have there's no contract according to the AG?
Sure, and so I think what we have said to you in the past is under Title 10, that process can continue. There can be terms and agreements agreed to, subject to a final contract being in place. And this is not completely without example. I was made aware by others that when the federal government procured the use of hotels for the Theodore Roosevelt, they agreed to terms, negotiated amounts, but did not yet, and still do not, have a final contract in place. That was because federal law itself recognizes the need to move in an emergency manner, with the fact that contracts will be finalized at a point when that time allows.
So I'm just want to make sure I'm completely clear. So the governor's son-in-law, the legal counsel, is in charge of negotiations for these quarantine isolation facilities?
I'm sorry, you're breaking up just a little. Go ahead and repeat that one more time.
Was the governor's son-in-law in charge of negotiations for the quarantine isolation facilities?
My understanding was that he did negotiate the terms and agreements, yes. But he negotiated those terms.
What is Perlis Court for?
Wow, Carlo Branch at a loss for words. I never thought. Go ahead, Carlo.
Sorry, what was that?
I'm sorry, say that one more time.
Perlis Court. What was he negotiating Perlis Court for?
So my understanding of the use of the facility at that time was that was for medical personnel, either doctors and nurses, who worked in the COVID isolation facilities. That is, they were specifically exposed to patients who were declared positives.
So that's a condo complex, right?
If we're talking about Perlis Court near Greyhound, yes, I believe that is the one.
Yeah, that's the only
Was
one.
it ever used?
I believe at some... I will have to get back to you on the answer to that.
Right.
My recollection is that it was, but I was not intimately involved with...
That's why we would like to talk to Hai. I mean, if he could call up here, that'd be great. So, Carlo...
I'm here.
I know, but you're not Hai, and you don't know. So you just said you don't know.
But I was...
Why don't you get us the guy who knows? It's simple. So simple. But just going back to Perlis Court, if you do know, how did Perlis Court get involved? They're not a member of the Guam Hotel Restaurant Association. And I know that initially the use of these hotels, quarantine facilities, the negotiations were with GHRA. So I'm kind of wondering, how did this condo complex, who's outside of GHRA, how did they get a or whatever? They don't have a contract. How did they get money? I mean, did someone, shoot up a flare?
I don't know that they got money yet. I'm not versed on who did or didn't.
Okay.
I do know that there were 2 call-outs to GHRA, and that we did business with everyone who responded under the budget price. Relative to Perlis Court, I don't have individual knowledge of that. I'm more than willing to get you an answer. But Chris, if you just allow me the ability to respond, I came here being willing to answer questions of myself, right? And the reason that I do not have answers to questions that you would ask Hai is I am not Hai. And so I'm willing to answer any question that I have knowledge to, and I'm doing that right now.
But you were willing to answer questions yesterday with the off-the-record interview with Haig and Sophia, and then with the caveat of, well, I'll answer on the record in writing after the off-the-record interview. So how could you not speak now?
Sure. As you stated yourself, Reed, that it would have also been Hai and Sophie, and they would have answered to what they could have answered, and I would have answered to what I could have answered.
So why couldn't we have done that on the record?
I just got to say, though, Carlo, that is like
with off-the-record interviews.
Yeah, that is just nonsense. Nonsense. In what world does the governor's legal counsel only agree to do an off-the-record interview? I mean, okay, who was Eddie's legal counsel? Who was Governor Eddie's legal?
Depends on the year.
Sandra Miller. Let's say Sandra Miller. I could never in my wildest dreams imagine Sandy Miller saying, oh, yeah, I can do an interview, but it's only going to be off the record, and any part you want on the record, this other guy is going to answer for me, maybe in writing. It's just insane that you would even offer us an off-the-record interview with the governor's son-in-law legal counsel. I don't understand. I mean, I feel like he gets paid $120,000 a year. He should be able to stand in and defend this work. And I don't, instead of getting you don't know anything about the procurement. I don't understand why.
I don't see how you don't know. You're the chief policy advisor of the governor.
Let's get the guy who's calling the shots.
Yeah, I'm the chief policy advisor, but I'm not legal.
But just why can't we get Hai? I don't understand. Why can't we get Hai on the record to answer questions? I mean, I'm assuming he's going to do it at the legislature.
Chris,
just why, Carlo?
And I'm here.
Okay.
And
I know. Yeah.
So anybody been paid? Any hotel been paid?
I do not know as a matter of absolute certainty. I am willing to get you that answer, whether it's on the radio or in writing, any way you like it.
Okay.
So
so
how can we? I just want to go back to. Can you just tell the people of Guam why the governor's son-in-law, legal counsel, who's paid over $120,000 a year to do his job, why he can't come out here and defend this procurement that a lot of people are saying is questionable. Linda DeNorcy's signature was used without her knowledge or approval. I mean, there's just so many red flags, Carlos, so I don't understand why we don't get Hai to call in. Why isn't there an opportunity for him to address these things on the record? It just seems kind of ludicrous that he's the guy who's going around negotiating all this stuff on behalf of the governor, but he can't, call in and answer some questions. It is. Come on, you can see it.
Chris, again, as I've said, I am here. I am answering questions. I understand your concern, and I will relay them, but I can speak for myself.
I mean, this would just be so easily solved if you guys threw Hai out there in the press conference and he was like, here I am, who's got questions? Not this, like, let me do an off-the-record interview and then Carlo's going to bail me out when it gets tough.
Well, I don't know that I could bail you out.
Oh, come on, Carlo.
Okay, so Carlo, we get it. You can't answer. You can't answer on behalf of Hai.
So I guess what we want to know is who has been paid, how much they've been paid.
He's going to get that for us.
Right. I'm just
So just currently, what facilities are being used for quarantine isolation facilities today? We have PacStar?
Yes, ma'am, that is correct. I believe that's a quarantine facility, not an isolation.
Oh, well, the document with Linda's signature on it said quarantine/isolation facility.
Sure, but your question to me was which ones are being used today as a quarantine facility.
Okay, quarantine/isolation facility.
Okay, so I will get you an accurate list. I can give you now based on my individual recollection.
Okay, so what facilities that Hai negotiated are still being used today?
My understanding is that obviously we are using the PacStar as the main quarantine facility, and there are one, maybe two other facilities, and I will get you the exact names. Right. I just don't want to mention the name and be inaccurate or wrong.
Well, I saw at Days Inn there were some guards people out there yesterday. So
and Days Inn is the government's isolation facility, ISO, right?
If you could also tell us maybe the number of people in the facilities. So for like PacStar, we heard.
When we answered Adriana's question, I believe the answer we gave her relative to PacStar was 140 individuals.
Right, yeah. So then I guess for Days Inn or whatever other facilities, Perlis Court, we'd also want to know how many people are... Because, if you're renting an empty hotel and there's like 2 people in it...
Sure. And we did give Adriana answers to this question on that same day as the press conference. Her 2-part question was, 1, how many individuals were there, and 2, why do you need the additional space? Right. There is a clear answer on why you need the additional space. It is in part because 2 things. Number 1, we have no scientific data on whether or not there could be a second wave relative to reinfection or resurgence. So if individuals do not have a suitable facility for isolation at home, you will need an isolation unit even if there are empty rooms. Second, we have received notice, and I think you have reported at times, on the fact that certain airlines are beginning to contemplate travel back to Guam. We have been clear that the governor does not have the authority to shut down the airport. Governor Ige of Hawaii also tested it and did not have the authority to shut down the main Hano airport. And so if flights begin to come into Guam without the ability to conduct rapid testing in infected countries, you will need potentially larger isolation units or quarantine facilities. And we are still in PCOR 1, and there may be the need to use that additional space.
I wanted to follow up on something that you talked to Chris about over the weekend with respect to Rebecca Respicio and Alice Tyron. Rebecca, she's the director of the Guam Energy Office. Tyron is the president of the Guam Housing Corporation. And you confirmed that they were staying at the PacStar because I guess they're 24/7 and they respond to the 140 quarantined individuals that are still at the PacStar. So do we have directors of government agencies also at these other quarantine facilities, isolation units that are staying at the hotel 24/7 to address the needs of people that are staying there?
My understanding is that there is staff support. There has been staff support at the other facilities. I don't know what rank the staff is relative to any overnight support, but I'm willing to get you that answer.
Well, I mean, you have a director, and she's grabbing towels, and is that kind of like what it sounds like you said?
Well, no, I believe my answer to Chris was that as part of the agreement, staff members were not permitted to have contact with quarantined individuals.
The hotel staff, right?
Yes, hotel staff was not permitted to have contact with quarantined individuals. So in the absence of quarantine staff being able to run food, blankets, respond to room problems, that is government staff that is doing that.
Specifically, Alice Tyron and Rebecca Respicio?
No, they have other staff that work there, right, Carlo?
Facility, yes.
There are other
My
staff.
response relative to overnight is who is doing the overnight duties. So Chris's question to me, and Chris, don't let me misstate it, was
I got it right here.
how many officials he asked me to confirm whether or not Rebecca and Alice were staying overnight at the PacStar to staff the facility. I said yes, and that their duties were to run that facility 24/7, and that there were only, on occasion, there were usually 2 staff members to do that overnight for 140 individuals. Right. He asked me a third question about a third person, and I said that I could not respond directly to that question because it was HIPAA protected.
Right.
So the HIPAA protected question.
Yeah, we asked why is John Kanata of the deputy of the airport staying at the Pacific Star, and you said you couldn't answer because of HIPAA.
Yes, that is what I said.
Okay, well, I think people kind of know what that means.
Yeah.
And
hey,
so having said that, is the PacStar also being used as an isolation facility?
No, it is being used as a quarantine facility.
Yeah. No, I know that. That's what I had thought, but when I saw the documents, it said quarantine isolation.
Yeah, and
Carlo, can you just maybe confirm this, or maybe check with Hi, or give us Hi, and we'll ask him. So I heard that, and we know this because we had interviewed Mary Rhodes. I went through some of the old clips. As when this all started, the hotels were only supposed to be quarantine facilities, and I have learned that their contracts were changed, and now some of them are isolation facilities, which they did not sign up for. And I'm told that had they known they were going to be isolation facilities, which is a whole other risk, there would have been a separate pricing. And so what we're being told is that these contracts are being changed after the fact with no input from the hotels. They're just basically saying, oh, now you're an isolation facility. And so is it Days Inn that's the isolation facility?
That's my understanding.
Right.
Understanding at this moment.
So I just got a tip here that there are only 2 people staying at Days Inn.
Yes. I don't know the number, but I understand that you are getting that tip, yeah.
Right, yeah.
And again,
so we just keep renting this hotel in case there's a surge?
So yes, relative to that number, and we have answered that question on the record numerous times. When times are good and the number of isolations is small, of course people will go, you have so many vacant rooms at the Days Inn. But if things go the other way, or things had gone the other way, then it will be, why hadn't you prepared enough isolation rooms? And so no one could quickly predict the number, type, and size of isolation facilities you would need. And we're, of course, if the number at Days Inn is small, I think I'm personally grateful for it. But while you do not have any data on resurgence, and I think, it was reported that 5 or 6 were declared negative and have come back resurgent, while we do not have data on resurgence, and we are waiting to move to laxer conditions under PCOR 2, we do not know, and we hope we do not need larger isolation facilities, but that possibility exists.
Okay. So, Tony Babauta, how long did he stay? Was it just really that one night?
My understanding from him and from those individuals that were there was that it was one evening.
And
Friday evening to Saturday morning.
What can you tell us about, we had heard from some sources that he was driving around in an unmarked Guam Police Department vehicle, a Dodge Durango. Is that just another benefit that you get as the chief of staff, or?
I don't have specific information on that. I can attempt to check.
Okay.
And then, with Tony, right? So, was it really just that he stayed at Pacific Star? Or, because you muted the media. You caused this whole crazy backlash against this administration. You caused so much pain, so much anger, so much mistrust. People have I think they're already losing faith, but it was just another thing that people could throw out and say, man, this government is dishonest. That you made that call, Carlo, but you just got off with an apology. And we all know that Tony was pretty much forced to resign. So you see, it's kind of a different, I don't know, let the punishment fit the crime. So was it just that he stayed overnight at the hotel, or was there something else with him being the signatory for the governor?
I think we all know that I wouldn't speak for Tony. He told me, I spoke with him briefly beforehand. He said he was going for his own reasons. I have to respect that.
Okay. In terms of the negotiations again with Haig, has anything been signed, and who is supposed to sign off on these contracts at the end of the day? Is it the GAR, or is it Charles Esteves? Is it Claudia Ekfaji, or is it Haig himself?
Or is it Linda and her digital signature? Can we just address that, though, Carlo? Why was the governor's legal counsel using Linda's digital signature, or whoever was using it, without her approval or knowledge? I mean, you can't walk away from this. She is.
I can only answer one question at a time.
Okay.
I'm willing to try to answer both.
Go ahead.
Which one would you like?
We can start with mine. Who's supposed to sign off on these contracts?
Okay. Relative to contracts, my understanding is that there are multiple signatories, including the Attorney General, and usually the process is that the final signature is always the governor on a finalized contract.
Mm-hmm. Does somebody have to certify, like there's funds available to pay for this?
Under traditional procurement, that is my understanding, yes.
Okay, non-traditional procurement?
Non-traditional procurement, I wouldn't be 100%, and that's an issue of legal interpretation, so I won't try.
See, if you got us high, it would just be, hey, hi, so what's the deal? It would just be boom, boom, shoo.
I'm sorry, just repeat that one more time. You're just bringing up that last part.
Right. I mean, if you had gotten us
he
high,
said if you had gotten us
if you gotten us high, we asked him the question, and it's like over.
Done.
Easy.
All I was told last night was that you would like to speak to me, and I'm here. I don't know about you trying to interview High.
Well, come on, Carlo. I asked you, and you guys said off the record only.
Other than our previous conversation.
Right, yeah.
And I have said that
we want to interview High. Well, how else do you want me to say it? Of course we do.
Sure, I understand.
Can we put in that request right now? We'd like to speak with Attorney Haig Hyun.
Yes, and
an
I
interview
will take that
on the record.
On the record.
Yes, I understand that it is on the record. I will.
That's how we roll, kind of.
So there was a second question. I don't recall what it was, but I'm willing to answer it.
You had the second question.
I forgot. Pretty sure it was a good one, though.
I think
If there are any other questions, I will continue to try and answer them.
Okay.
My head's just spinning right now. I don't think I have anything. Okay, I might as well ask. So did you speak with Linda, or anybody speak with Linda about the digital signature? That's what he wanted. He asked.
That's what I was asking, yeah.
That she said she didn't sign, her digital signature was used?
I can go back and read her comments. I think I'm going to do that, Carlo, just to give you some context in case you haven't seen them. And this is pretty crazy. She had said, I asked her, Linda, can you confirm your signature was used without your knowledge to sign the hotel quarantine documents? Chris, I want to make it clear that I have nothing to do with quarantine properties and quarantine hotel negotiations. Yes, I recognize my signature, but it was an electronic signature, and I don't recognize this document because I have never seen it before. And then I said, Linda, do they have your permission to use your digital signature? Also, would you have signed those documents if they presented them to you for signing? Her response, Chris, the normal procedure is that I get a call from legal counsel for permission to use my signature, and if I authorize it, then the document should be sent to me. Second part of your question, no. I will not sign these documents if they presented them to me, because I do not deal with procurement of quarantine and isolation facilities. Linda DeNorsi. So it seems pretty firm there that she's got a problem with you guys using her. Whoever down there is stamping her signature on stuff without her approval, that's a major problem. We had Senator Sabina Paris say it's fraud. And she's the procurement oversight. So how do you respond to that, I guess?
Sure. So it is my understanding, in accordance with Linda's comments to you, Chris, that there is a process where She will authorize the use of her digital signature upon reading of a document by legal counsel. And what I believe happened, based on my conversations with Linda, was these documents were presented to her as procurement documents relative to the quarantine facilities. It is true and accurate that these are not procurement documents. They are not documents that obligate funds or the agreement to pay monies. These are documents designating the facilities as proper facilities for non-congregate shelter. And that is shelter where multiple individuals will live and have individual bathrooms and beds but share a common area. And so when Linda was asked the question, did you sign, these procurement documents or documents obligating quarantine, it was my understanding that she rightly responded no. Then it is also my understanding that she that she does remember having signed a multitude of documents, that she does not remember these specific documents, but she does remember documents in general relative to non-congregate shelters designation. It's not procurements, not contracts, not terms.
So you're basically saying Linda was confused. You're saying Linda DeNorsi was confused.
No, I'm saying she, A, does not remember signing those documents, but B, she has never signed procurement documents, and that's true and accurate.
Right, yeah.
So my understanding from...
But I didn't ask her about procurement documents. I just asked her hotel quarantine documents. I never used the word procurement. And I actually spoke to her again yesterday afternoon to kind of, get her take on, hey, you said these things, are you doubling down, tripling down? She goes, no, Chris, those are my answers. I stand by them. So I got to go with what Linda says.
Yeah, and I'm not disavowing what Linda says either. It is my understanding that there was a process, that it did involve legal counsel and legal counsel's reading of documents to Linda for authorized use of her signature. That is my understanding of the process.
When did you speak with Linda?
Yesterday morning. In the Post story yesterday, this is where I'm getting the use of the phrase procurement. I believe they phrased it as, she signed procurement documents. And I asked her if she ever did, and she said absolutely not. That's why she refused them. And I said, do you recall signing documents designating non-congregate shelter? And she said, I signed a multitude of documents, and I authorized documents every time they were read. She said, Carlo, I do not remember these specific documents. And I said, okay. And but I didn't, but she did make clear to me that she had never signed procurement documents, and I pointed out to her that those are not procurement documents.
Yeah. The point is, you're trying to clutter the point. The point is that she said that she's seen her say it wasn't supposed to be used. She didn't have approval or knowledge of it, and that's what she said. So.
Sure, and I can say to you that what she said to me, which I believe is consistent, is that she did not recall.
Okay. Right. Well, you guys, she's saying different things to the two of you, all right? Okay.
I think she's playing us.
But definitely Title 10 doesn't give anybody any authority, right, to use somebody else's digital signature.
Does HIE have the authority to use people's signature without their consent?
Not without their permission, no.
Okay. So is HIE negotiating anything else aside from hotel
food
quarantine?
Services, maybe? I heard something about food services that are being provided without a contract.
I don't have eyes on that particularly.
But if he got us high, we would be able to ask him.
But do you know if he is negotiating anything else on behalf of the governor?
I'm sorry, one more time.
Do you know if Attorney Haig is negotiating anything else on behalf of the governor?
Anything else on behalf of the governor? No,
right, but related to COVID, aside from the quarantine/isolation facilities, is he negotiating anything else?
Not to my personal knowledge, but again, I'm willing to ask. So if either of you want to send me a list of things...
Why don't you just work on getting us the interview with HIE?
I also said that I would do that.
Thank you. I appreciate that.
Okay. So what is the plan we're going to be seeing today? We hear that it's going to deal with long-awaited public assistance, local assistance, I'm sorry.
Sure. So my understanding is that the plan will deal with a local cash assistance program. Relative to those who were impacted by the pandemic disaster.
Mm-hmm.
Are we talking? I heard something like $2,000 to the unemployed. Can you give us any more details on that?
I'll wait for the governor to present it at the press conference.
Mm-hmm. And what about?
Are we hot or cold on that, Carlo? Though $2,000.
I'm neutral on commenting on that specific matter.
What about the transparency initiative?
Sure. She will discuss that also at the press conference, is my understanding, and then walk through the various points of that plan.
Right. And then you're also going to find out for us, because you don't know, right, who's authorized to sign contracts under Title 10, High or Linda?
Oh, no, you asked me who is authorized to sign contracts. I said there are multiple signatures required for any GovGuam contract.
How about on
You said
Title
that
10?
was traditional, but on non-traditional.
And the new way to do it.
Sure, that's a legal question. I'm more than happy to ask legal.
Or you could just get us the legal and we could ask him
Yes,
ourselves.
and I've responded that I would try 7 different times by my count.
Right. Appreciate that.
Thank you all 7 times for responding.
Yeah.
I think
Are you good?
no, I did want to ask about there's something that's here. One of our viewers on our live stream is asking about the double pay issue. I know that Senator Joe Estin-Agostini wrote a letter to Edward Byrne wanting an explanation as to why double pay has not been paid out to first responders or essential employees.
Yes, ma'am. My understanding is that the senator's response is forthcoming.
You can't respond?
That's a DOA issue, so DOA.
Well, you know that we can't even get DOA unless we get approval from the Adelup.
And you're here talking, about the procurement, with the governor's son-in-law legal counsel. It's free reign, but you can't talk about DOA?
No, I believe that we set up DOA and VBMR to appear on your show.
Yeah.
Tomorrow morning.
I think, we got Lester tomorrow.
It was my understanding that they'd be able to answer your questions.
Okay, cool.
In detail.
Oh, okay, thanks.
Yeah, Bree, I'm getting them tomorrow.
Okay.
And I believe that was arranged last night. So.
It was.
Do you foresee this double pay being paid out?
I think Lester and Byrne, particularly Ed Byrne, will be able to answer that for you in the morning.
Okay. I'm done, I think.
Yeah. I guess just one last question. There was a comment here. I can't find it now, but it was basically, why don't you guys put out the communications director, Janella Carrera? I mean, you've seen it in past administrations. Oya was out here answering tough stuff. She was a big girl. She went out and she could face the media. But every time, we need something they send you. So are you like the only guy there who knows what he's talking about? Or why don't you want to send Janella out? Because, she's the communications director.
I'm sorry, restate your question.
Why don't we hear from the communications director?
I think you...
we do. No, and I work together, the guess I got that, but I'm just saying in a traditional setting, again, I got to just reference the last administration, you would have, if this was a situation where, I'm going to talk show or whatever, it would have been Oya, not whoever the policy guy was, and it was routinely Oya. So I'm just wondering why we don't, we're paying this communications director, why isn't she out there more saying things, doing things other than introducing reporters at the press conference? I think it's a fair question, Carlo.
Sure. And I'll answer it, and I could say every administration was different. I was a part of the administration beforehand, and there was a spokesperson, and there was a director of communications. And sometimes the director of communications is not acting in a spokesperson role. And so I understand that KOAM is referring to the prior administration. I can point out other examples in other administrations where the director of communications was in charge of communications, but was not always on all matters the spokesperson, or wasn't even designated.
But you're neither.
Let me see.
But you're neither
Sean
the
Gumatata was the director of communications, and I believe he did interviews multiple times.
Yeah.
Sean was the director of communications in the last 2 years of the Camacho Cruz administration. There was a director of communications beforehand, and there was a spokesperson beforehand. In fact, Sean's role before director of communications and before policy advisor was spokesperson at one point.
Right, and even when he was the director of communications, he still did interviews.
I'll just ask you this, Carlo. Are you confident that you can send Janella out to the media and she can sit in and answer the questions that we're asking you?
Your question is, am I confident in Janella? Yes.
No, it's not. It's are you confident in her to call up, to do the interviews, to face the questions that you're facing?
I'm confident in my ability to face questions on matters of policy. I am confident on her ability to communicate the administration's message, whether it's on air with you or anyone else.
Yeah, so you should get her to call in more. Door's always open.
Yes, and thank you for always being open to our phone calls.
Of course. You can say that with a little more gusto there, Carl.
Oh, I haven't had coffee, and I've been holding the phone for 45 minutes.
Okay.
All right, Carlo, we'll let you go. We know you got a big press conference today, and especially we want to thank you for extending it so that we could ask our questions along with the Post and I guess whoever else, what other media wants to hang on the phone or on the Zoom conference. So thanks.
Yeah.
Sure. Thank you, and I appreciate the time to speak with you, and I know you have other questions. I know the first one is we want legal counsel. If I missed any others, you can message me, and Chris knows I always respond.
Right. Yeah.
Will do. Thank you.
Thank you.
Okay, take care.
Right on. Wash your hands. 8:46. Let's keep it, man. I hope we still got Superintendent John Fernandez. Soup? Okay, I'll go get him. We'll take a little break. It's 8:45. Man, Carlo Branch, comments. What do you guys think? I think it's pretty clear.
I want to thank him, though, for coming on.
Yeah. But I mean, he's like the only guy they have that can go out and answer stuff. It's crazy. We're paying all these people. We're paying the governor's son-in-law legal counsel. He can't even go and answer questions.
I'm still mind blown that he's handling negotiations.
Yeah.
Because the governor has superpowers under Title 10, but yet we have a pandemic annex response plan that clearly says that when a pandemic occurs, that Guam Homeland Security Civil Defense, one of their main roles is to deal with procurement.
Yeah, I don't know, Bree. I felt like we had him on the phone for 45 minutes, but even more questions. Is that how you feel?
I need a break now, okay?
We're going to take a break. Hey, it's Guam's favorite, the KUAM News Takeover containing COVID. Good morning.
Join us in salute.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
On Giving Tuesday now, May 5th, 2020, the KOAM Care Force, in partnership with 7 Day Market, is challenging the community to the Get One, Give One challenge. On this day, we ask that shoppers consider adding a non-perishable food item or items to their shopping carts and make a donation to the Salvation Army and the Catholic Social Services while shopping at the 7 Day Market in Zonia or Harmon. After purchasing your donations, drop them at the designated in-store area. It's an easy way to show a family in need that you care. We can all do our part on Giving Tuesday now on May 5th.
$8:52. Good
Jason
morning.
does that really well.
Yeah, he's pretty good at that.
What is that called? What is it called?
Scatting.
Scat?
Yeah.
Come on, can you just give us a little taste, Jason?
Yeah. Don't get him on here. 8:52. Let's get Superintendent John Fernandez on. Good morning, Soup.
Hey, happy Chris, and happy Sabrina.
Happy.
So graduation's officially canceled. Do you kind of want to go in on the release that you guys had sent out yesterday afternoon?
Yeah, and if you don't mind, I just want to take a quick moment. Just during the school year, this would normally be a Teacher Appreciation Week, as well as tomorrow would be our National School Nurses Day. And I just want to say to all of our teachers out there, just really say a big thank you, Dr. Nancy Duas-Masi, for all the work, and especially those who are still working and still reaching out to their kids and supporting them through the lessons that they're getting at home, and we're supporting parents as well. And then also, for our school nurses who are out there, we've got about 40 nurses deployed in various parts of the COVID-19 response. Just want to make sure that they know we're thinking of them and looking out for their safety and well-being as well. But on to graduation, I just want to let everybody know it's a totally terrible position to be in, to be the one to let everybody know that our traditional planned graduation ceremonies aren't going to be happening this year. And we really wanted to delay this decision as much as possible. A lot of us wanted to hope maybe things will change, but as the emergency situation has continued to extend, also just kind of learning a little bit more about UOG's plans. We heard that UOG and GCC are also planning to look at a virtual ceremony versus a physical ceremony. Our ceremonies are planned on the first week of June, and it just didn't. It's just not going to happen on that schedule. So we really need to let our high schools know, our classes, as well as our principals, to know that if there's any time and a chance to prepare for an alternative type of celebration, we need to get those plans finalized so that we don't lose that opportunity. And we'll try to support them in their efforts. So that was really the need to really make that decision so the schools could move forward with their alternative planning. And later this week, we'll be meeting with all the principals to get a handle on what their needs are, what the plans are, what the classes want to do, and then we're going to do what we can to support their efforts.
Have you heard any alternatives, any suggestions?
Well, a lot of we've seen a lot of examples of things that are already happening, maybe around the world and on the mainland, in terms of things like, virtual ceremonies, of course, where the ceremony takes place online. Also, you know how we do our grab and go, almost like a drive-through graduation ceremony where students can come and pick up their diplomas. Suggestions about some types of or form of a motorcade type of ceremony where people are in their cars and they get to celebrate, but maintaining the social distancing and all the other safety requirements. So we've asked the schools to go ahead and think through the various ways they might want to celebrate. And then we also have some classes who suggested that if there are funds available, making a donation to support our frontliners or other worthy causes during this pandemic. So normally, and I want to remind everybody, the central office and the Guam Education Board, we don't really get involved in the planning of the celebration. That normally takes place at the school level, and the classes get to make their unique, school ceremonies, very special for them. So this is kind of an unusual situation, but again, we want to allow them to be creative, find an alternative way to celebrate, and then we're going to do our best to support them.
Is your daughter graduating?
No, but I have been picking her brain. It's almost like, what if you were in this situation? What options would you look at? And of course, she's paying attention to all the social media stuff that other high schoolers are doing. So I try to test somebody's thoughts out there.
Right.
But again, it's really important that the graduating classes have a say in what that alternative is. And so they just really needed to kind of get the message, get the decision that it's not really going to happen under Plan A, which was to gather at the field house. But now we can move to Plan B because if we don't start putting those plans in place now, we're going to run out of time. So we do have a lot of parents and students saying, what about postponing it? What about delaying it? We're certainly open to that. We just want to remind them that the longer this goes on and this gets pushed out further and further, it becomes a risk that it might not happen at all. So we want to see what we can do to strike that balance and celebrate our class appropriately. And I also want people to know we don't take this lightly as if it's just a ceremony. We understand the importance to families and students, to celebrate this milestone in their youngsters' lives. And so we really tried not to have to make this decision if we didn't have to, but at some point we have to move forward and make sure we don't lose the opportunity to have a worthwhile celebration that's safe and can be done during this type of situation.
Okay, just real quickly, because Chris is giving me the sign,
Sorry.
the signal. I wanted to ask, what was the status of FBLG?
So, basically the healthcare status, I would, the individuals get their healthcare information. We kind of get word indirectly here and there. My understanding is that even though I'm not aware of any positive tests, they were required to get quarantine for safety purposes. Anyone who gets tested was given instruction to at least quarantine for a certain amount of time, knowing that there was somebody positive in their midst that had tested positive. So we got a range of 7 to 14 days quarantine. So we're just gonna go with 14 days, and then we'll make a decision about reopening, especially letting the time go so we can clean the facility as well.
Right.
Okay,
Soup.
Anything else you wanted to get out?
Right.
No, well, I do want the seniors, the class of 2020, to know that there's a lot of questions that they have, and I wanted just to point them to our website. Yesterday, we did a full update of our class of 2020 page to answer a lot of the questions that are coming through emails and texts and so forth. So we asked them go to our homepage, www.gdoe.net. There's a class of 2020 link. Go there, and you'll have a chance to look at the responses and also ask further questions. So we want them to go there and get the information they need.
Got it. www.gdoe.net.
Correct.
All right.
Thank you, Soup.
All right. Thank
you.
Wash
Stay
your hands.
safe.
Yes, definitely.
Okay. 8:59. Let's keep it going here.
I wanted to just let people know that we do have an online program for the class of 2020.
Right.
Jason, did you want to share with everybody what we're doing? No? Okay. All right. Well, yeah, we're celebrating the class of 2020 with a special bi-weekly feature that starts actually this week.
Right. Starts tomorrow.
Right. Tomorrow. And so every Wednesday and Friday throughout the months of May and June, we'll be featuring members from this historic class. So parents, friends, family, graduates themselves, you can submit your graduation photos to class of 2020 at KUAM.com with name, school, and a brief message. Just send it again to class of 2020 at KUAM.com, and we'll have it featured on Wednesdays and Fridays throughout the month of May and June.
Right, 9 o'clock. Okay, so, we had talked yesterday, it was in the news about recovered COVID-19 patients who are testing positive now for coronavirus. So we wanted to bring Dr. Jana McGlutnia onto the show of Public Health. Good morning, Doc.
Good morning.
Good morning.
Thanks for coming onto the show. First time on here. I guess, how are you doing? We'll start there.
I'm fine, thank you.
So,
I hope you're all well.
Yeah, we are. And I guess just the people have questions about the science of COVID-19 recovery. And so we had got the news yesterday that I think it was 5 or 6 recovered COVID-19 patients are now have now tested positive for COVID-19. Can you just kind of go into the weeds and explain the science and how this is possible?
Yes, and I'm going to have to try to let me know if I need to modify it a little bit for a greater understanding. But let's go to the testing. The testing is very, very accurate. It's a PCR test, big process, complicated process. It's a test we also use for tuberculosis. And what we know, how does it work? What does it look for? The test itself is fine, but you have to know what it's looking for. And when the virus attacks the cell, or when our immune system attacks the virus, when it attacks the cell, it attacks the outside of the cell and doesn't burrow deep into the center, which is a good thing. When our immune system attacks the virus, it also attacks the outside, the envelope, which makes it infectious, and we can render it non-infectious by attacking that envelope. What does that leave? It leaves the inside, the nucleic acids are still swimming around. They can't do much, but they're still there. So those dead fragments are floating around. So when we do the test, that test picks up nuclear fragments. And that's exactly what we're looking for. When we put the test in the machine, we say, okay, tell us, do you see any footprint of that virus? And it says yes. Then if you say, is it alive or dead? Because we know that through convalescence and with time and with healing, those will be dead particles. So if I look at the machine and say, okay, you found it. Is it dead or alive? The machine says, I don't know. You didn't ask me that. And so that's where the machine limits, that's where they leave off. And so that's, it's a technical limit. So the test is good for what it's looking for, but it can't answer every question you might have. So what we find in TB and what we find in the virus so far, and again, it's rapidly evolving, and this is what we know today. And based on some recent, like a few days ago, studies in South Korea, they had 263 patients who did the very same thing. They tested them. They said, okay, you're virus free. And then they retested, and don't you know, the test lit up again. What they're finding is those little crappy things flitting around that are dead are still being picked up by the machine even 1 to 2 months later. We see this with tuberculosis every day in our lab because we run the same test on our tuberculosis. So how do we know if it's dead or alive? Well, with TB, if I'm treating you for 2 months, I know that you're looking at 6 to 9 months of treatment anyway. So I send it to Hawaii and say, hey, here's the swab, here's the sputum, tell me what you got, see if anything grows, because I need to know if it's alive or dead. And they try to grow it out. If it doesn't grow out, we know it's dead bacteria. And that's almost 100% of the cases. And it's just good to know.
Yeah.
Well,
so are they contagious, I guess, Dr. McGlutnia is the question. So
there's been no evidence. Okay, that's the other thing. So the test does pick it up, but it may be dead. Next thing, is it infectious? There's been no evidence to date on the South Korean studies that show that those particles are infectious at all. And in Guam, we have seen the same thing. We haven't seen anyone get infected on someone who tested twice. And another question is, are we relapsing? Well, a relapse would imply that it gets into the nucleus and causes a chronic infection. It can't get in there. It doesn't have the capacity to do that. And then are they reinfected? Well, that would imply that it's mutating. And although it has mutated slightly, just little snippets, not enough to reinfect the patient. So there have been no evidence of infectivity, reinfections, relapse, or a recurrent infection of any kind. So that's where we are today.
What can you tell us about the use of the VTM and the performance of the Abbott testing? Because I know there was the national reports that came out and said that it would lend itself to false negatives. Are we still using the VTM with the Abbott, and how do you respond to those reports?
Okay, the Abbott ID Now, it just rolled out not too long ago. They found that the results were very valid if you avoided using viral transport media in 3 milliliters of viral transport media, and if you could just take the swab directly to the machine. Okay, because that's the way that you can. There are different ways you can use that machine. Right. One is using the viral transport media, which is the VTM, in 3 milliliters, and they found that they were having false negatives with that. Okay. I got several pronged answer to this. Okay, first of all, we never did that. We used 1 milliliters because we were trying to conserve those VTM tubes because there weren't many. So our lab automatically, and not because of this, we had already taken the 3 milliliter aliquots and reduced them to 1 milliliter, which improves the accuracy of it. So we didn't know that at the time that would be an issue, but we happened to have done that. Second of all, we quit using it April 28th because our volume went up so high that we couldn't use those one-by-one tests because you have to do it one at a time. We run the big machines where we batch it. So we tended not to use it because we had so many tests coming in.
Okay.
GMH uses the machine, but they do directly swab to machine. So, and another thing, so we avoided the issues because by just using direct swabs and by having accidentally and inadvertently reducing our aliquots to 1 milliliter. Now, having said that, too, I stood and watched the test being validated, and we did take out, because we had only used the 1 milliliter tube from the beginning trying to conserve, I watched them test 10 to 15 samples back to back, and we were 100% in sync. GMH also has sent over tests just to be safe when they felt like someone may really have the disease and they tested negative. They sent them for confirmation on our equipment. So we've done checks and balances right and left, some intentional and some inadvertent.
Just for clarification, you said you went from 3 to 1 milliliter. Is that right?
Aliquots. The VTM tubes have usually they come with 3 milliliters of solution, and we didn't have enough tubes, and we knew that 1 milliliter would work on the platforms that we have to test. So we had already taken 1 tube and made 3, and we didn't do it because of the Abbott ID Now. We did it to conserve and extend the quantity or increase the quantity of tubes that we had. So we had already reduced it down to 1.
Right. And did Abbott, I guess the company that produces the VTMs, did they say that that was okay?
The VTMs. They don't produce the VTMs.
Okay, well,
that's a different company.
Okay, well, reducing it to conserve, right? Did anybody say or vet this and say, okay, that's totally okay. It's okay to do that.
It's not even whether it's okay. We reduced it to the smallest amount we needed to do the extractions for the machine. Yeah. And now you're getting into technical stuff. And I'll just blurt it out. We do extractions and then we run panel kits. If we have enough to extract it, then we go down to that limit. We don't drop below 1 because we want to extract all we can from that sample. And so 1 milliliter is perfect for the PCR extraction.
Doc, can we just go back to the recovery process? So are patients who are deemed recovered tested before they're
deemed recovered
or declared recovered? I mean, do you get tested to be a recovery, or do you just be
wait
observed?
The 72 hours?
Right.
Yeah.
The CDC currently has 2 options. Well, actually now 3.
One for testing and one without testing.
One for testing, one for non-testing, and we have done the non-testing because we didn't. Initially, because we didn't have enough tests. Now we do. But initially we did the non-test path, and after over 100 of those released, we haven't had any evidence of infections from any of those people. And again, there's no evidence that anyone can infect anyone after the illness is convalescing. Now, that's not to say your symptoms will be resolved. the metric used by CDC is that the symptoms have improved. And generally, let's go to symptoms, because if people are looking for that as a sign of cure or recovery, if it improves, yes, but symptoms vary from patient to patient. If you look at some of the social media and the online blogs where patients are posting, they're saying their symptoms are lasting as much as a month. And in fact, I was looking at one patient who said that she was in her mid-50s, and she said that she's on day 30 still having headaches and fatigue. Then there's another one named Lauren Nichols, 32 years old. She's on day 51 and is keeping a daily log, and her symptoms are still persisting. So in general, we say if you've had a mild go of it, 10 to 14 days improved. But if it involves the lungs, you're looking at a month, 6 weeks or more.
Right. So, Doc, what triggered these recovered patients to be tested again? Was it part of the follow-up process, or were they not feeling well?
Continued symptoms. And one person said, I just want to know for peace of mind. But now we have tests available, so we're doing it anyway on anyone.
So sorry, Doc, of the 6, what did you say? Because you kind of cut off there. One of them just wanted a peace of mind.
One had no symptoms and just wanted peace of mind. And some of the others were having lingering symptoms or had never been tested. Because if you came in 2 months ago and said, I'm sick, I need checked, and we find out you're positive, and the household had similar symptoms, we just said, assume you're infected, everyone go home and isolate, because what else could it be, at that point? And we didn't have enough testing capability at that time. But now testing capability is less of an issue, and so some of those got tested because they had never been tested and they just wanted to see the test. So now they are probably having the dead fragments picked up as well.
Mm-hmm. Well, speaking of testing, I'm not sure if you could answer this, but could you tell us where we are with the expanded testing? I know that Hemlani Apartments in Harmon was on Saturday. Have we already started moving into St. Dominic's and Guma Tranquilidad?
St. Dominic's is today, and I don't know about the other one. Hemlani, we did that one Saturday. We spent 3 days in Estumbo, another evening in Nilau, and Agate on Saturday too. I think that, maybe Friday. Yeah. But yeah.
So St. Dominic's today.
St. Dominic's today.
Okay, and then do you know when Guma Tranquilidad is?
I wouldn't know, but that's a different team.
I
so
see.
I'm sure someone else has that answer, but I'm sorry, I don't have that.
No
one.
problem.
Yeah.
All right. Okay.
Okay.
Does it make sense what I'm saying? Just because it's a lot of medical.
No, I get it. There's leftovers in the people, leftover virus in the people that's not active.
Junk.
It's like crumbs and stuff, and it's not contagious.
Right. There's no evidence. Again, there are a lot of unknowns. But what they do know, because this is a brand new virus, what they do know is we're following South Korea, and they just published this on Sunday, and they said, guess what? We had 263 with the same thing. And no evidence of reinfection, no evidence of relapse, no evidence of infectivity. And, and I know the community is probably scratching their head going, gosh, why does this change every day? If you tell me that you have strep throat, I can lay down a treatment plan for you right now. A to B, this is what's going to happen. With this being a new virus, and as CDC says, rapidly evolving, someone came in and handed us an illness in January and said, not going to tell you where you're going, but every day I'm going to tell you, do this, do that. And then tomorrow I might even change that plan based on what we found the day before. Mm-hmm. And where we're going to end up, can't even tell you that either. We're trying to forge a path through the jungle and trying to keep everyone safe. And so you're going to have some people call in and go, okay, if there's no evidence of infectivity, why did you put me back in isolation for 14 days? Which we did. We did that using an abundance of precaution, because until someone hands me definitive data saying non-infectious, no problem, until I see that, we're going to keep the patient safe, family safe, and community safe. We did that just to be on the safe side. because we don't know. And I know I'm choosing a very conservative path. I'm even more conservative than the CDC even recommends. But I say but I'm speaking for our teams. But we feel that's the safest thing. Until we know, then be safe.
Right. Well, thank you, Doc. It was definitely good to talk with you. And now that I got your number, any kind of like testing, scientific stuff, we're going to call you.
Sounds good.
Thank you.
Thank you, Doc.
Thank you for having me on, and I hope it made sense.
It did. Wash your hands.
Thank you. Take care.
Okay, thanks.
Okay, bye. 9:15. That was Dr. Jana Maglotnia, of course, DPHSS's chief epidemiologist. Thank you guys for watching our Facebook live stream here on Containing COVID, KUM News Takeover, Guam's favorite. Let's keep it going here. I wanted to get FEMA Frank Mansell onto the show. Of course, good morning.
Hi, Frank.
Good morning. Sorry, I had to take you off mute.
No worries.
Chris,
he's got jokes.
Wow, you got jokes.
Chris.
Yes, I'm here.
I wake up in the middle of the night and I wash my hands. Never done that before.
Well, you're welcome, Frank.
Oh, my goodness.
So I guess update on, we got some questions for you, but I guess we'll just start on, can we just get a general update on the FEMA response locally here with COVID-19?
Well, I can tell you that more commodities have come in to the island. And again, I'm giving you numbers of materials that we actually can put our hands on or know that we've passed along to the territory. N95 masks are at 51 million. Surgical...
51 million?
Pardon me?
You said 51 million?
51 million. Surgical masks are 43 million. Gowns, 10 million. Face shields, 9 million. Coveralls, I don't know why, but they're only 400. Gloves are 60 million. Those are all items that were pushed out under the Strategic National Stockpile.
To Guam?
Guam has its request.
Okay.
And of its requests, we've delivered 3,000 biohazard bags, 40 million gloves, 1,800 test kits, which are swabs in the media, and a total of 59 ventilators. There's been 3,000 gloves donated and 5,500 N95 masks that were donated. To date, FEMA has obligated $9.8 million in either direct federal assistance or mission assignments.
9.8 million?
That's correct.
When you say that, what do you mean? That it was like
well, it means
turned
obligated.
Over?
It means that those are funds that we've the value of the commodities we've delivered.
Okay.
Okay, Frank, let's just get right into it here. I've been told that FEMA, as I don't know if you can comment on this, if it's at your level, but that the way, as it stands right now, the quarantine facilities being used by the government of Guam, the hotels, we don't have the paperwork, not reimbursable. How accurate is that at this moment?
Until we have the paperwork, there's no review to conduct. So at this point, we have to see paperwork before we can review it.
So you've gotten no paperwork for these congregate shelters, these quarantine isolation facilities, nothing, zero, zilch?
I have not seen anything or heard of anything.
You don't have like an email or something, or a piece of paper?
I do not. I don't know that it would have crossed my desk, but I can reach back and see. But I don't believe we've gotten anything submitted yet. Okay. Usually these things have to. I guess it depends whether they hold them and submit them all at once, or if they submit them monthly. I'm not sure how that process works, other than the fact that documentation has to be provided.
And so what sort of documentation has to be provided for federal reimbursement, say for these quarantine isolation facilities?
Well, it would be in the form of, I think we had talked about this over the weekend, but I think we had talked about receipts, invoices from the hotels, cost of the meals, cost of security, and other items that were associated with keeping that facility open and functioning.
Mm-hmm. And that includes personnel working the facility. So government personnel working.
Anything needed in what is called wraparound services.
Mm-hmm.
So sometimes that's just what you need to keep the facility functioning and effective.
Okay. I know we also talked about over the weekend briefly was the situation with the homeless shelter that the government was planning to open down at the Paseo. And when we last talked on the air, you had mentioned that there were discussions, or the government had approached FEMA regarding the use of or providing tents. Right?
Yes, that's correct.
And so whatever happened with those discussions?
Well, essentially, it revolved around the fact that the tents that we had following Typhoon U2, we had depleted a number of our tents. And the tents that are here on the island are meant for the Pacific, so it would cover Northern Marianas. Some of that might be available for Hawaii if there was a hurricane out there. Some of it's meant for here or American Samoa. So we have a stockpile of tents, and the ask was to provide that stockpile. We have not totally replenished that stockpile yet because there's such a specialty item. So we had indicated to the territory that really wasn't a good option.
Mm-hmm. And these particular tents were a certain size that weren't necessarily, from what we were discussing, didn't fit the guidelines that Health and Human Services were recommending to be used in the sort of situation that the government of Guam wanted to use them for?
Well, I think there's guidance that comes out from time to time, and we have had, and I don't think the CDC necessarily had this guidance pre-written because this is such a unique disaster, but their new revised guidance, interim guidance, would indicate that they were looking at 12 feet by 12 feet per person.
This is HHS.
Correct.
Okay, right. And the ones that you have in the stockpile
are 16 by 16, so that would have meant one person per tent.
And so I understand HHS and even the Homeless Coalition people, they've recommended a motel apartment type setting over, the baseball field tents. Is that accurate?
I know that they're re-looking at it. I think the fact of the matter is, if it's that coalition that's advising the committee, and it's certainly a committee of folks that are trying to make this happen, I think the recommendation was that they look at that as an alternative for any number of reasons.
Mm-hmm. Is this something that would be reimbursable?
Yes, it could be.
Okay, I just want to make sure. And so just what's the cost share for reimbursement? Is it 75-20?
Generally 75-25.
Generally, is it still? I mean, what else would it be?
Right out the gate, it's usually 100% for the first 30 days.
I see.
And then thereafter. Now, there are agreements whenever a disaster is declared. There is something called a federal state or a federal territory agreement, whereby everything is hammered out and then written down, and it's signed by both parties as to how this will unfold.
Mm-hmm.
Frank, I guess going back to, you said FEMA doesn't have a single piece of paper on this, hotel quarantine deal. Is that normal? Because you've been through a lot of disasters, and I'm just wondering, by now, would something have crossed your desk?
I know that it can take a long time for paperwork to flow through, and I've seen sometimes public assistance documents and projects can literally take a decade to complete, depending on the complexity of them. This one I'm not too sure about, and as I said, I have not seen anything in the email or heard of anything being submitted yet.
I see. So it could take as long as the government takes to submit all the paperwork, basically.
Yeah, like I say, it has to start somewhere.
Right, and what's the turnaround typically when the government sends the paperwork
like I
for
say,
reimbursement?
It depends on the complexity.
I see.
Certainly, it's if you look at it like a chess match or a chess game where you're playing and you make your move and then you hit the bell and then it times for 3 minutes and then somebody has to get an answer back to you in that next 3 minutes, or you have to make your next chess move in 3 minutes, then you hit the bell.
Mm-hmm.
Sometimes that goes on.
Yeah.
And, in the case of a natural disaster, when you have reconstruction of highways or things like that, you have to go through the environmental protection and make sure that everything is built to the current code. So that can take some time. Mm-hmm. I know there are certainly structures from Katrina that have not been rebuilt yet. Mm-hmm. So that's just sometimes the way it works.
Mm-hmm. Can you just clarify what is a non-congregate shelter? Can it be for homeless?
That would be for, well, in the case of the hotels, that would be for
the quarantine
purposes.
Right.
And in this particular case, I believe they're using it for the same thing.
Okay, for quarantine/isolation facilities.
I'm guessing I would not have a definitive yes or no on that,
okay.
But it sounds that's the way it would be.
Okay.
Are there like conversations with you, Frank, or the FEMA side where local government says, hey, how do we do this procurement thing? Do you guys provide guidance?
Guidance is provided. Certainly this is not the first time that we have been here. And it's not the first time that public assistance has been offered on the island for disasters.
Mm-hmm.
So I imagine training has taken place.
I would imagine.
The part of the training say that, the governor's legal counsel should be handling negotiations for procurement during a pandemic. Or maybe it should be left to Guam Homeland Security Office of Civil Defense.
You got me there. I don't know what you want me to say. I'm not sure what the federal-state agreement looks like.
Right.
Who is FEMA's, I guess, direct contact with the government of Guam? Is it Charles Esteves? Is it?
Well, it's a person called the governor's authorized representative.
Right. Who's the GAR?
We know it was Tony Babauta, but
we know it was.
He ran into a little bit of difficulty.
Yeah, so right now those agreements are being rewritten and redrawn and re-signed.
What agreements are rewritten?
Well, because
the federal-state agreement that indicates
who the GAR is.
Correct.
So, do you guys know? Or
I don't, but I imagine that paperwork is being looked at.
Was it something that has to be approved by the feds on who could be? What do you mean?
No,
it's just whoever. It's just whoever the governor. Whoever the governor.
Providing a new name.
I
right.
see.
Yeah.
I see.
Okay.
And a deputy. So.
Mm-hmm.
All right. So that's being changed, but you don't know who it's going to be. You haven't heard.
No.
Mm-hmm.
We did. We asked Carlo that, right?
I think so.
Probably. Okay. So was there anything, I mean, without a GAR in place for the last how many days, were there things that could have gotten by us, or is there an interim GAR? How does that whole thing work?
I think there would be a deputy, and work would continue under the deputy until a new agreement is signed.
Okay.
Was there ever a deputy GAR?
I don't know.
Was there ever a deputy GAR?
Yes, there was.
Who was the deputy?
I'd have to go back and ask, but there was a deputy.
We know the main one was Tony Babauta, right?
Yeah, I believe that's the case.
Okay.
Okay, so you don't recall who the deputy
You want me to throw out some names? Was it maybe Hai Hun?
You caught me flat there.
Okay, but you can just check on that for us, right, Frank?
Mm-hmm.
Okay, appreciate it.
Charles Estevez? That sound familiar?
Well, certainly the name is familiar, but it's. I don't believe that was the deputy.
Okay.
Okay, we'll find out.
Okay.
Thank you.
All right, Frank, appreciate it.
You're welcome, and yeah, we'll provide you updates on what we've got here as far as goods in the hands of the folks at Health and Human Services.
Right, appreciate it. And any update you can give us? You know, like I said, we try and bring you on every week to kind of just let us know where we're at with FEMA and all that.
Mm-hmm. Pleasure to do that.
Okay.
Are you settling in okay? Where are you? You work out of the, are you at the JIC, Frank, or are you at the Homeland, or?
We're at the Department of Civil Defense and the Homeland Security office here on the Hill.
Oh, so you are with the JIC?
Yes. I guess so.
Okay. Is they just giving you a table there or something as part of the response,
We are working at tables.
Nice. Oh. Okay.
Tell everybody we said hi.
No, don't say you know us, Frank. Don't say you know us.
All right. Well, wash your hands, Chris.
Thank you, Frank. Wash your hands.
You
Take
first.
care.
Okay. Bye.
Bye-bye.
Oh, man. FEMA Frank, Guam's favorite.
I want to know who the deputy GAR is.
Yeah, well, let's ask somebody. We're going to take a little break.
Okay.
We're going to ask somebody. It's 9:31, Guam's favorite. The KUM News takeover of I-94 is containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Good morning. Look at this sky. Guam's favorite, I-94 933. Let's go over to the NMI with some breaking news. Our CNMI correspondent for KUAM News, Tomas Manglotnia. Good morning, Tomas.
Good morning, Bree and Chris. We're hearing news this morning of the passing of former NMI Governor Froilan Camacho Tenorio. We're hearing he passed away early this morning in Texas, and a statement from the CNMI Governor's office is forthcoming according to the Press Secretary, Kevin Bautista. The Press Secretary here in the NMI, Kevin Bautista, tells us that flags will be going down to half-staff today in honor of the governor, of the late Governor Froilan Camacho Tenorio.
Okay, Tomas, thank you for that breaking news. And now with the very latest COVID-19, the CNMI. Again, Tomas, thank you.
Here's the latest on containing COVID in the Northern Marianas. We wanted to play a clip released by the governor's office on the procedure for inbound passengers in the CNMI as more flights touch down on Saipan. Take a listen.
I'm Dr. Beth Conan from CHCC. I'm the Deputy Chief Medical Officer. We're here at the screening at PIC for the incoming travelers. United is now traveling, bringing in people to the CNMI 3 times a week. Today we had 38 passengers arrive. The process is that CODA picks them up at the airport, brings them to PIC. We have a team here to receive them. It starts, they pick up their luggage here, they go through customs, they meet with quarantine people for fruits, vegetables, invasive species, and then they're screened with a medical screen. If they're doing well, then they get sent to a room here at PIC. There's 2 choices for them then. They can either stay 14 days in quarantine, or they can have the same test as we're doing for the community-based testing and wait for those results. If those results come back negative, they can leave quarantine early. We are anticipating that most people will be able to leave within 5 days. So that means that instead of saying 14 days, they only have to stay 5. People who have come from someplace and they have a certificate that they've had a negative test within the last 72 hours are released as well. Everyone who either comes through and or is released and or completes quarantine is still asked to do the social distancing at home, continue to do hand washing, follow the curfew rules, and be careful about touching their face.
We also have an update from the CHCC CEO, Esther Muñoz. She says that so far, as of Sunday night, 1,022 test results came back as negative from the community-based testing initiative. Again, that's as of Sunday night, 1,022 negative results from the CNMI's community-based testing initiative. Muñoz says that as of yesterday, 22 people remain at the Pacific Islands Club facility in quarantine, and 0 people as of yesterday at the Canoa Resort Isolation Facility. The CNMI Governor's Office says that they're also providing hard copies of the results from community-based testing upon request. He adds that they're looking into the option of providing email results, though due to HIPAA requirements, they need to be encrypted in the emails. They say that it would require individuals who may not be technologically literate to do things on their email that they're not familiar with. We also asked the hospital CEO, Esther Muñoz, about comments on any outreach efforts to expand the testing and encourage people to get tested. Muñoz tells KUAM early this morning that at this time, they have a steady amount of people coming in for the lab to process, and they also have their dialysis patients tested. She adds that they'll be doing outreach in the coming week, including outreach to the Manamco and other high-risk population. KUAM also asked the CEO, Esther Muñoz, about any plans for testing on the islands of Rota and Tinian. She tells us that Rota and Tinian residents can expect community-based testing to start next week. We asked if they're planning to test any people at home or other options than for those who cannot make it through drive-through testing. She says that for collection of specimens, it's not off the table. They're receiving calls from family members calling for those who are challenged going to the airport for the drive-through testing. Also in other news, the CNMI Labor announces phone numbers for the pandemic unemployment assistance. According to Secretary of Labor Vicky Beneventi, the CNMI PUA implementation plan is in review by the U.S. Department of Labor, Employment and Training Administration. Vicky Beneventi says that this week, the CNMI Department of Labor is in training sessions for phase 1 of the plan, which is the initial claims process. They encourage anyone with general questions regarding PUA and the FPUC programs to call the phone numbers they provided yesterday as between the hours of 8 a.m. to 12 p.m. Monday to Friday. The first of those numbers, 670-989-9090, 670-989-9089, and you can find the rest of that information on governor.gov.mp. The Secretary of Labor here in the CNMI also says that if you cannot get through the line, to please try again or email info@puamarianas.com. They say that residents should not send personal or sensitive information over email. Again, if you cannot get through that phone line for the NMI with regards to the PUA program and the FPUC, you can email info@puamarianas.com if you're in the NMI. Bree and Chris, we also wanted to give the latest numbers as of May 5th from the Commonwealth Healthcare Corporation. The number of confirmed cases in the NMI as of May 5th remain at 14, with a pair of deaths and 12 recoveries. And the cumulative number of persons tested through community testing initiative as of May 5th is 1,480. Bree and Chris?
Thank you, Tomas. I just want to go back to what you said. So let me get this straight. In the CNMI, if you are in a government quarantine facility, you can ask to be tested, and if you test negative, they let you out early.
My understanding is that that process is available for those incoming travelers. And right now, and so that process that Dr. Beth Conan outlined is that you can either stay for the 14 days or you can get tested, as you said, and be released if that test result comes back as negative.
Interesting, because I know you heard that call we had with a gentleman yesterday who was at Pacific Star saying, hey, test me now. If I'm negative, let me go. If I'm positive, whatever. So they're doing it in the CNMI.
Yes, and I think a lot of residents I've spoken with are obviously grateful for that opportunity to opt into testing, as 14 days in any facility can be especially grueling for a resident to undergo.
Okay, thanks, Tomas.
Right. What else are you working on for today, Tomas?
Well, of course, we want to get the latest information of the early news we're hearing of the passing of the former CNMI Governor Tenorio. We heard that, of course, again, he was in Texas, and that the press secretary, Kevin Bautista, here in the NMI tells us that flags will be going down to half-staff in honor of the late Governor Tenorio. And so we want to get more information on that. And with regards to COVID-19 news, we're also working to get more comment from the Saipan Chamber of Commerce on their opinions as flights open up to the Northern Mariana Islands, and whether or not they have comments or plans for businesses to reopen as well as that happens.
Okay. Anything in closing, Tomas?
That's it. Again, we're waiting to hear more results from the community-based testing. It looks like, based on the numbers this morning, we're waiting to hear back for about 400 other results. As we know, so far 1,022 results from the community-based testing initiative here in the NMI came back as negative. And so we're going to continue to monitor those numbers and get everyone the latest information with regards to containing COVID here in the NMI.
All right. Thank you, Tomas.
Thank you so much. Have a good day.
Wash your hands. Always 9:42. Guam's favorite. Are they going into session at 10 a.m., Bree?
Yes, they are.
They are.
And I think we just got a copy of
the agenda.
The agenda.
Right.
It's kind of small. I don't know where my glasses are. Let's see if I can see. Can you see it? 'Cause it's really small.
Yeah, kind of. I need my glasses too.
Actually, I don't need my glasses.
Okay. Yeah.
So it's vetoed Bill 7. That's on the agenda, establishing an administrative fine for the director of member agency of the application review committee which fails to provide required reports under position blah 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 blah. Veto Bill 259. I'm trying to look for the ones that deal with COVID. This is 259. That's dealing with vacancies in the municipal offices of mayor and vice mayor. Where's 333? Okay, there. Bill 333 is there. Bill 336 is on here, and that's also another Senator Therese Terlahi bill, and that's related to the expedited procurement of critical medical supplies. And then Bill 326 is also on here, and that is the one dealing with the COVID hazard pay differential in light of the COVID-19 pandemic. So the three bills that were recently vetoed by the governor: 333, transparency; 336, purchase of critical medical supplies; and 326, dealing with the COVID hazard differential pay / double pay.
Right.
On the agenda for 10 o'clock today.
All right, and so that's going to be another session. After this, let's all go watch session.
Wait, there's also Bill 341. That's going to be on there. I'd have to look that up. 344, 345, 353. And there are a couple of resolutions. I'll look that up.
Okay.
I don't have it in front of me.
Okay, we're going to go get that. We take a quick break. It's 9:44. KUM News Takeover, Guam's favorite, containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
On Giving Tuesday now, May 5th, 2020, the KUAM Care Force, in partnership with 7 Day Market, is challenging the community to the Get One, Give One challenge. On this day, we ask that shoppers consider adding a non-perishable food item or items to their shopping carts and make a donation to the Salvation Army and the Catholic Social Services while shopping at the 7 Day Market in Zonia or Harmon. After purchasing your donations, drop them at the designated in-store area. It's an easy way to show a family in need that you care. We can all do our part on Giving Tuesday now on May 5th. Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
So 9:48. Hey, shout out to Ambrose Inc., IT&E, Cabo Enterprises, Coast 360,
and Bank of Guam.
Yes, proudly sponsoring our Containing COVID multimedia radio show broadcast extravaganza. Remember, this is only temporary. All of this shall pass. Yeah, so we decided the best way to get you guys all the info you need is to do this daily radio show, and we kind of also did it at a time when, we're staying home, staying in the office, and trying to get information from here, all the information out there. And so you got us. I think the thinking is that as long as we keep extending this public health emergency, maybe that's what it is. Maybe the governor loves our show so much that she's just going to keep extending the public health emergency so that I can continue to wake up early so Sabrina can continue to bring.
Well, today would have been the day that it would have ended, right? But it was extended again for another 30 days. What we are looking forward to, hopefully, if things continue on the same trend and path, that Saturday, right? I think it's May 9th.
Right, gradual reopening. Of
we might be in PCOR 2.
Right, so now we're in PCOR 1, Jay.
Okay, we have had this has been by far our most commented on show in the 6.5 weeks that we've been doing this program now, especially when we had Carlo Branch earlier on. I mean, I know you guys were trying to keep up with it. Joser and I were back here. So many comments, really interesting discussions. I mean, a lot of snark, some playful snipes and everything like that, but people were really engaged in the issue.
Right.
Amazingly, we've had over 1,200 comments. Only one of them actually said Happy Cinco de Mayo, guys.
Yeah, I was thinking that in a normal world, this would have been Cinco de Mayo. But guess what? Day in a normal world.
And you know what? I remember you very poignantly, I thought, what was it, in week 2 or week 3 of this? You came back on the air after commercial break and you're like, man, worst Mes Chamorro ever. I remember that. That was very good.
Hey, remember, it's Chamorro year, actually.
I mean, that was not very good, but, the way you phrased it.
Thank you, Jay.
Yeah.
Okay.
And we've got that, of course, we led the show with Daphne Shimizu from Revan Tax, and I know we're going to talk about that now, but the information is up here. The email address, the phone numbers, and who you have to contact if you want to find out more information about the forthcoming stimulus payments.
Right.
All right. I guess I don't even need to do that, so there you got it.
You're good then.
Well, I mean, U.S. Treasury, IRS, they finally approved the Department of Revenue and Taxation's implementation plan for the stimulus checks to come out. Daphne said that they were working on it. Her and her staff have been working, actually. She said she was up since 2, 3 in the morning talking with
she texted me this morning that's been her schedule for the last month and a half or whatever.
Yeah, so, they're working on getting these checks out, which she said would be in a couple of weeks. So thanks to everybody over at Revan Tax. We know, I mean, we've been talking to Daphne, right, every so now and then, and you hear it in her voice how much she cares, and she really has been working hard to get these checks out. And for me, she's just like one of my COVID heroes, just because you could hear it, relying on her faith, prayer, and just wonderful people that she works with to get the island through this.
Can I just ask that of you guys? I mean, not like we want to make this a popularity contest or anything like that. But if so far, I mean, you guys have anointed certain people COVID heroes, right? Of the many people that we have interviewed over and over so far in the almost 2 months that we've done the show now, who would be your Mount Rushmore of containing COVID guests?
Jeez, Jay. Way to make us play favorites.
Yeah.
No comment.
Yeah.
You're all equally heroes.
You gotta give me something. I mean, and this will be an ever-evolving list, obviously.
It's hard to say because, I mean, there's so many heroes out there, people that are giving back to the community.
No, I mean, the people that we've interviewed, like the best interviews, the people that have, been able to interact with us really, really well.
We love all our interviews.
Yeah.
That was very diplomatic.
Yeah.
All of them.
They're all the best.
Yep. The bestest.
So that interview with Carlo Branch that we did, we're going to cut it up, put it on the YouTube. But basically, there's going to be a new way of doing business. The old way must die, and that's happening at the press conference today.
Right. So there was this I don't even know offer floating around yesterday about one-on-one interviews with the governor for half an hour, and we just said that we don't really need that. We can just do it at the press conference instead of creating a whole nother time and schedule when we already have this live established. We might as well just make the use of it. Apparently she has all the time to do these one-on-one afterwards. We don't need it. We'll just do it then.
I mean, it's kind of like you got to wonder, did she always have the time? Because if they're offering 30 minutes to each media, let's see, that's your KUAM, Post, PM.
And I mean, if other media want to do the one-on-one, then that's fine.
That's like 2 to 3 hours of additional time.
So,
and I'm just thinking, damn, if you had all this time, why didn't you just let us ask more than 2 questions?
Right. But during this press conference, she's supposed to unveil her plans for providing local assistance. I know everybody's been asking, wanting to know what's going on as we wait for the PUA and the FPUC and the stimulus checks. Yeah. So stimulus checks off the list check. It's going to be coming out in a couple of weeks. And so now we're going to hear from the governor. What is her plan? I mean,
it's a big plan.
We've been waiting for it, but you know. So at least she's going to present something this afternoon. I think maybe the press conference is at 1 o'clock. Yeah,
they're going to give out money. That's what the plan is. They're going to give out money. We don't know the details of is it going to be for people who have, lost their jobs, been furloughed, or had hours cut, or is it going to be something with income?
Mm-hmm.
We don't know, but they have this $117 million mountain of federal cash that they've been sitting on. The guidance has come out since April 22nd.
And hopefully they will provide a breakdown of where all of the money's going to go. $118 million. We know the $7 million. They're looking at it to go to the quarantine/isolation facilities. So what is that? 111. So 111, and then whatever else. I know Regine Biscoe-Lee. She had her suggestions where she felt the money should go, at least a portion of it. So at 1 o'clock, I think the press conference that's the time.
Right.
We'll be broadcasting it like we always do, and it should be an extended one because we heard from Carlo Branch that we're going to be able to get our questions in.
So let's clear our schedule for this afternoon. I know you guys are, stay home, but let's clear it and let's make some time because this is not going to be your average 50-minute deal.
Okay, can I just throw this in there? Even though you guys were like I said, judicious and non-committal to saying who would be your Mount Rushmore of interview guests, I'm actually getting some private WhatsApp messages right now. Mary Rhodes has gotten 2 votes already. Mary's been very, very good since day one.
Is it one of those years?
I guess, well, you know what? We'll make some kind of poll. We'll show
I have to say yes. Mary Rhodes is.
Yeah,
she's
been very, very good.
Oh,
we'll,
and she knows her stuff.
And she answers all. I like the interviews where they answer all the questions.
Mm-hmm.
Linda, I think, is one of my favorite people to interview, just because, she has vital information.
And now that I think about it, prior to our interview today with Carlo, which was about 45 minutes and change, Mary held the record for longest containing COVID interview because she was at 38.
Mm-hmm.
So, we'll do what we do is, we crowdsource and we let our community take over. So we're going to say, who have been your favorite interviews on containing COVID? You can go on our YouTube channel, look at all the past stuff and everything. Obviously, everybody's got, people that talk about things they're interested in, but let us know who you like the best because we've had amazing guests.
I think one of my favorite ones, too, was the interview we did with the Adelup press secretary, Crystal Pacos and Augustine, our former colleague. That was, I'm going to go listen to that again later.
And my phone is getting ever since I opened my mouth about the WhatsApp thing, now I'm getting messages from everybody.
We should start playing our old interviews, Bree. Hey, remember this one? Containing COVID's greatest hits.
Ooh.
Then you could get we could get a nice little break, go eat breakfast,
That's how long we've been doing this show now. We can actually do a throwback Thursday on this show.
For real.
9:57. So I had this whole good note set up this morning, but unfortunately, Mayor McDonald is still at the doctor. He has a doctor's appointment.
Okay.
But I have all the stuff, so I'm just going to go ahead. Yeah, I want to.
Go ahead. It's Giving Tuesday.
It is, right. Okay, so we'll just save this and then we'll do Giving Tuesday.
Go ahead. Yeah, because he was going to participate in Giving Tuesday, right? Right. His family.
Yeah. And so what the mayor, the staff, and the family have done is they made 8 huge donations, and we've got Joe, you got the pictures? We got Joe Sir here. The first donation they made was down at the port of Guam, where they had donated 440 cups of ice cream for all the staff. They also donated to DOE nurses and public health pens. There was over 1,000 writing utensils for all staff at the Guam Memorial Hospital. Agania Heights Elementary School received 125 stationary items. Grab and Grub received 60 food-themed pens for all the restaurant partners and 75 food-themed pens for all the drivers. Donation 5 of 8. Guam Customs received 136 law enforcement-themed pens. 6 of 8. Behavioral Health and Wellness got pens for their entire staff. Agania, let's see here. The mayor's staff, they also made a donation. And there's also something here about the mayor teaching farming. So I think that's pretty cool.
Nice. Over the past, we have a special that's airing tonight at 6:30 after the primetime newscast, and we're just going to be highlighting several people out in the community and several businesses that have been doing their part, have been stepping up and giving back to the community. I know that you were at several donations that were done by the 7-Day Supermarket and the Jeju Province Development Corporation. And I think 14 Korean grocery markets, they came together. They made donations to Guam Homeland Security. There were donations to Guam DOE and to UOG. There's about 150 students from the FAS that are stuck here because flights have been canceled. And so they've been relying on donations from the community. And so 7-Day Supermarket and the Jeju Province Development Corporation, they donated, I think, 50 cases of water for these kids. They also donated to Catholic Social Services, I think, how many? 250 cases of water each to CSS and Salvation Army. So we're going to be highlighting them today. There's Papa John's. They're donating to the Guam Memorial Hospital, pizzas to the frontline heroes over there, and to the Guam Regional Medical City. I think we've got stories about GTA, how they donated to GRMC, and other
basically
organizations.
There's just so much giving and donating going on that it's like we need 5 more Giving Tuesday Now shows.
Yeah.
There's just a lot, and this time is.
And it doesn't have to be just today. Every day that
Yeah.
you, if you can, to help, would be greatly appreciated. But
You know,
when
Chris,
you do something today, please remember to use the hashtag Giving Tuesday Now.
You always talk about, you said this many times on the show, but you said, there's so much Inafamaulik that goes on in the community. If you have never really known what that means and everything like that, I mean, there's military themes on it. Basically, we don't leave our people behind.
Yeah.
Your neighbors are your family. It doesn't matter if you're blood related to them and everything like that. And whether they ask you...
We're all crossing that finish line.
Exactly. Truly, we are all in this together.
Amen. Thank you for that, Jay. As always, some great insight from Jason
I've been
Salas.
sitting here for 4 hours, man. I just want to say hi.
It's just like, hi. Say hi to your
did.
people.
Earlier I said, hey, come on.
Yeah,
You're
you
like,
got some fans out there. Go ahead, say hi.
All right, just a reminder, any questions before
Can
we
somebody
let you
say hi to
go?
Jason? Sorry.
Yeah, please, on the stream. But before we let you go, just a reminder that the U.S. Treasury and the IRS, they gave approval for the economic stimulus checks that the Department of Revenue and Taxation is working to get the checks cut. It'll take about a couple weeks from now.
Yeah.
But if you have any questions at all, call the phone numbers, I think, on your screen, or they should be coming up on your screen, 635-1840 for 14257 or 635-7603. You can also email guameip@revtax.guam.gov. Big thank you, big shout out to everybody at DRT.
All right. Well, there you go.
All right.
Yeah, let's DRT employees, staff, Daphne Shimizu, you are our COVID heroes for today. And let's get those checks. Let's get those checks out there, man. 10:02. Good job today, Sabrina.
Good job to you. Good job, guys.
We'll see you guys at the press conference. Also, our digital team behind the scenes, if you know what I mean, Joser and Jason Salas. Thank you, guys. To our KUAM TV family over Master Control, KUAM TV 11, thanks for getting the show on. Last 2 hours, of course, always KUAM TV 11 with the live stream. Thank you. Last but not least, thank you to our Facebook Live audience. You guys have been tremendous. Loving the comments. I always go through and read them after the show. So God bless you guys. God bless Guam. And thank you, Bree.
Thank you, Christopher.
Hey, my name's Chris. Está. Adios.
Bye.